much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hand.
Stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hand.
Stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hand.
Stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hand.
Stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hand.
Stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of our Mother Earth. Reach out your hand.
Heal the earth, heal the earth, heal the earth. they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of a Mother Earth. Reach out your hand.
They can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. Give the children of a Mother Earth. Reach out your hand.
They can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Global Namaste, good morning, good afternoon, and good evening to all the lovely viewers of Healing Our Earth. I'm your host, Amrita, and I welcome you to this beautiful episode of today. Before we start this episode and talk more and chit chat on today's theme of integrated health in concerns with the arthritis and joint issues, let's start with the Gayatri mantra. Om. ॐ भूर्भुवस्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात् ॐ भूर्भुवस्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात् ॐ भूर्भुवस्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात् ॐ शान्ति शान्ति शान्तिः As you all know, that we bring to you every week something new, something different, something interactive, interesting, and full of knowledge and education as well as fun. In today's episode, we are going to talk about arthritis and joint pain issues. Most of the time, we find people across us in our families or around who develop joint issues, joint inflammations, and they complain of joint pains. My hands are aching suddenly, or when I get up in the morning, my hands become very stiff. When I am moving, my knees hurt sometimes, or my hip has got a pain, and suddenly they come up. We don't know what they are and how these pains are coming and what are the reasons behind them. And then we think of that, oh, have I really gone aged that these things are happening? But it's not really true. Every time, age is not just the concern. There can be many other medical, lifestyle, health, as well as general issues related to our normal life that can affect our musculoskeletal system. And that is why in today's episode of Integrated Health, we bring to you the talk about how important it is to know about joint pains, to take care of your body, and what are the causes and the concerns for us. I'm very glad to welcome our today's guest with me, who is a resident contributor, as well as a famous orthopedician, and much more, who believes in holistic healing, as well as he's a spinal surgeon. He has been, and good afternoon and a global namaste, Dr. Anukul Goswamiji. Namaskar. Joint issues have been a primary concern, and today's episode is purely dedicated on understanding about joints. So, can you please just share your experience with us before we take our next guest from Singapore, Sabuhi? Over to you. Thank you.
Thank you, Amrita. There's in our normal clinical practice, we by and large see many patients with various kind of inflammatory conditions, non-inflammatory conditions, various infective pathology, and immunological conditions, which can all contribute to pain. But one of the most common causes of pain, which is often not recognized, is the lack of activities and the right abnormal, not the right type of diet, what you call conditions in the environment, which can also contribute to the pain. So it is very easy in our systems of conventional medicine to be able to make a diagnosis clearly by history, taking some blood tests, doing some basic examination like x-rays and things like that. And then we come to a fairly reasonable conclusion. It's much more easier to manage with these because there are drugs and medications for this. But what happens when people are having various other kind of pains like body aches and pains from fibromyalgia, psychological effects, social factors, and other immunological factors, dietary factors, various kind of intestinal disorders, which also can produce pain. They are some of the things which are often not taken into account in normal clinic. And that's where I find many patients coming back with years of history of pain and nobody really recognizes. Simply said by the doctor, your blood tests are all normal, everything is okay, I don't know what it is, just do your activities and it should be fine. But they get very upset, and that's where I usually come in and ask for various other things and figure out what's going on.
Yeah,
I'm sure
that's
I learned so much from everybody that's here.
That's very nice. And what you have said is very right, Dr. Anukul. On those words, let's welcome our first guest, Sabuhi, who is the creator of Aroma Coach Transition, which is a hybrid method for the clients for their personal as well as professional transition working on aromatherapy. Global Namaste and a very good evening, Sabuhi.
Good evening. Thank you for inviting me. I was listening to what the doctor was saying earlier, and he's absolutely right. There's more to pain management than just the medication. We have to look into the person as an individual, as a lifestyle, as what are the daily capabilities. Pain is something that can compromise a person's 100%. And I don't know if I can share some slides because I had prepared something for today's talk.
Yeah, sure. You can share the slides.
Okay.
We can, you are the co-host, then you can share the slides, definitely. And
Okay.
on that verge, I definitely remember this thing that what compromises is the quality of life of an individual. And when it
Yes.
comes to the quality of life that gets affected, people are certainly visiting here and there and seeing what next. Oh, we can see your slides. Can you please make it full screen?
Yeah, I'm just gonna do that. Can you
So,
can you
yes.
see it being full screen?
Yes, yes.
Awesome. So,
Not yet.
oh,
It's not full screen as yet. Yeah. In a slideshow mode.
Let me just do that again.
Yeah. So
Technology
you come
is
from, yes, you can try. You come from a biomedical background, and then you
yes.
have been practicing aromatherapy and guiding people about how aromas can be beneficial for the body and which kind of aromas are good for working for the joint pains, for other kind of ailments, for inflammatory conditions, which is very interesting. And aromatherapy is a big integral part of this therapy of integrative medicine. And
Yes.
so,
So,
yes.
what got me into this was actually the fact that there is more to aromatherapy than just the cosmetic part of it or the spa part of it. There are
Mhm.
actually some components in it. I mean, like I'm a coach as well as an aromatherapist, and I do have a background in biomedical sciences, and I specialize in cancer biology. And one of the things that I noticed a lot was that people could not manage their pain, and it was actually interfering with their motivation. So I came up with something called ACT, which is aromatherapy coaching and a form of transition. So what is aromatherapy? It is so much more than just that spa part. It is an art and science of blending. We blend different chemical components in a therapeutic way, in a keeping in mind that this is going to be a holistic and supportive blend to help them manage their day-to-day mood, their pain, their emotions, even their ability to show up. Because arthritis, especially chronic acute pain related problems, they can be managed. I don't know if there's 100% full cure for it. I never give that hope to anyone. I always say we try our best. We learn to understand it, and we, go with the tides of it. So some days will be good, some days will be bad. But what I do give them definite hope and support for sure is, because I don't want to give any false promises, is that we will show up 100%. We will give our best to this situation. I remember I had this specific client that comes to mind every time I talk about this pain management. This person was like in their mid 40s, very, very active, suddenly developed arthritis in the toe, and it started spreading. And I said to him that, we can't. We don't know how far this is going to progress or where it will go, but what we can do, especially with rheumatoid arthritis, is that we can manage the pain, we can manage the symptoms, we can start becoming more aware and mindful of our body. um, there is this part of aromatherapy that's so interesting, which is called psychoneuroimmunology, because it's about your mindset, which affects your behavior, which affects your um, immune system. So it's all about how you are communicating with your immune system. In coaching, we give that support and that partnership. We help the person become more emotionally intelligent and aware of themselves to maximize their potential to manage themselves. It's about giving back that power that gets taken away from them when they are not able to manage their pain. So it's like a partnership. We come in, we make blends. It doesn't have to be a painful process. It doesn't have to be a doom and gloom death sentence type of thing that, oh my God, my whole life is now going to be full of pain. Um, what is transition? So a lot of people talk about being transformative coaches. I like to talk about being a transitional coach because it is just that period of time. People do get through point A to point B. And during that time, it is that supportive process, it is that comforting process. Transition is started by a catalyst. What is it that's like point A is the pain, point B is I would like to be pain free. So it's like a transformation. And it is because of your behavioral flexibility, that I want to change. I want things to be different. This is my goal. Is my weight contributing to my thing? My diet is contributing to this, my lifestyle, my genetics, my environment. How am I taking back my control? Um, you know, I want people to feel that they have options. There is this beautiful quote that I came across for especially just for this talk today, that tolerance and acceptance, they are a part of our life, both in how we perceive others as well as how we are received. How about this? We apply this to ourselves as well. Because how do we perceive ourselves and how do we receive ourselves? If our circumstances have changed, if our situation has changed, how are we talking to ourselves, communicating to ourselves, disempowering ourselves or empowering ourselves as we go through the different stages in our life? It does not just apply to pain management, it actually applies to a life management, a whole being management as a person through different transitions of their life. Um, so it's like a trifecta that allows a person, where the aromatherapy comes in, the coaching comes in, and there are different tools and techniques that are absolutely useful, because it's not just about the physical application of the oil that have analgesic and other properties, or it's not just about the coaching, it's also about the letting go of the baggage, the emotional pain that we hold on to, that is a contributing factor as well. It's also about developing habits, like the discipline to show up, knowing that this food doesn't work for me, it flares me up, doing something that causes the pain to exacerbate, having that support system, learning how to talk to ourselves with empowerment and positivity. And then the biggest thing in transition that I've seen is the kindness we can give ourselves, the patience we can give ourselves, because it is a journey at the end of the day, which allows us to come to the space of inner, peace, alignment. It gives us wisdom. It gives us a little bit of pause. And the biggest thing out of all of it is love. That how we have shown up with love for ourselves. And then in that space we are able to fill our jug so we can fill other people's cups, because just because we have a pain does not mean that we are helpless or that we cannot show up for ourselves. It's just taking ourselves moment by moment, day by day. The biggest thing I have found very useful when talking about pain is, where's your pain? How much pain are you feeling? The best way to ask yourself is, where is my pain? Touch that area. How much pain is there? What pain would I like? What level would I like it to go to? What can I do to bring it down to this level? Knowing that if I don't take care of myself at this level of pain, it will flare up to this level of pain. Just knowing how to manage yourself will give you that space, that freedom that doesn't cripple a person and make that person, immobile or dependent on others. Yes, there are some very extreme cases as well. It's all about your mindset, that how much are you willing to show up for yourself. Some of the blends I have been exploring are based on their actually component properties. So with essential oils, we have certain categories, certain notable components. Some of them are like lactones or ketones or monoterpenes and sesquiterpenes, because these are all like part of an organic compound. What are the properties we generally look into when it comes to aromatherapy? Because I am a clinical aromatherapist, I look into things like if it's analgesic, if it's anti-inflammatory, if it's spasmodic, if it's detoxifying, purifying, calming, sedative, if it's a vasodilator. Because I want to create blends for the different things. Like in arthritis, there are days which are just maintenance, there are days which is extreme flare-ups, then there are days where it's acute pain and you want to just do something immediately to relieve that pain, because the brain doesn't think at that time. You're just in too much pain. So what are the different things you can do? You can use warming or cooling compress, you can soak, you can do massage, you can do bath, you can do a bath gel where you can you can use it, on a daily basis, certain oils that help with inflammation or detoxifying, so that doesn't like there's no toxic buildup that actually contributes to rheumatoid arthritic pain, or something like when it's anti-inflammatory, like you do something that's immune supporting, so that the building up of factors that contribute to the inflammation go down. You can even do topical application, which is very common in aromatherapy. Then, there's notable essential oils. I don't want to overwhelm people, but I would like them to maybe get a bit experimental, maybe seek help from their local clinical aromatherapist, maybe go online, use proper resources, empower themselves, look into the food that matters to them, look into how they can turn simple habits into things that support them rather than things that are disempowering them. you know there's lavender, there's black pepper, geranium, peppermint, ginger, and cachepot. There's so many oils, but these are the basic oils. Out of it, the one I will say, oh, please have lavender, because it is the easiest, one of the most safest oils to use. It has something called hydrosol, which is water, which is also something a person can use daily, especially for people who have early onset arthritis and joint pain. We always consume, there's this formula, called the golden formula of turmeric, milk, ginger, and black pepper. But there's more to that, because there's so many people who don't even want to take that, although it is very nice for some, and some people are like, no. So I'm like, okay, don't feel like there's no hope. There's always hope. And like even with the inflammatory oils, like there are so many of them. And if you notice, I put lavender there as well. If I had to say leave today with one thing, I would be like, look into lavender. I put in lemon, I put in German chamomile, which is an amazing, amazing anti-inflammatory. It is one of the fastest, quickest anti-inflammatory oils I've ever seen. Cypress, grapefruit, sweet marjoram, Ravensara. We spoke earlier about nerve pain. Does anyone know that Ravensara is actually used for shingles pain? Like people generally don't have this information. And I have family members who have arthritis, who have joint pain, who have shingles pain, who have fibromyalgia. Ravensara is used for that. Um, there are, each person's body chemistry is different. It's better to go for a personal um, consultation. One of the things I also do is I work with doctors, because I 100% believe you must get your blood test done. You must find out what is the root cause of the issue you're going through. You must speak to all the professionals in your life you possibly can and make your own plan. Don't just depend on one opinion. It's always a good idea to take charge and not feel helpless. Um, I love lavender because of what it says, that it's all about the sweet transformation to go from point A to point B. And I don't know if I have time or not, but I wanted to leave the conversation in this note that it's all about your mindset, as well as understanding that pain is not just in your head. It is a physical feeling by your body as well. And to acknowledge that, not to ignore that I'll get it checked later, I'll see it later. No, check it. Ask questions. You don't like what the doctor said, get another doctor. you know um, Use your own innate intelligence and wisdom to help yourself. Um,
Sabohi, what a
yeah,
wonderful presentation. You are very passionate in what you are doing. And of
thank
course,
you.
time in Singapore is coming to 9:30 in the evening. So thank you for staying late. If you can turn off your presentation, I want to ask you one question before we move to Prague, Thomas.
Yes,
So,
I'm open to questions.
so Sabuhi, one of the questions that people are asking, and because we are actually connected to social media through our website, YouTube, Facebook, and
Yes,
Telegram live transmission,
yes.
2-3 of the people are asking, are there any reaction by using these products?
Yes. So if you noticed in my last slide, the safety precautions apply. And in the last part, I said no wintergreen, because one of the things is wintergreen is a blood thinner. So a lot of the generic pain relief balms and oils have wintergreen in it, and we use it willy-nilly. And they contain something called methyl salicylicate. So that is actually something that requires a lot of safety precaution and should not be used on a daily basis the way it is abused and used. There are other safety precautions if you're pregnant, if you're on heart medication, if you have a skin sensitivity. That's why an individual consultation is so important, because you go through the list of medications, you work in conjunction with a doctor if that person is seeing a doctor. You create a safe plan. If at the top of my head I had to say, oh, is there one safety precaution? No, there are many safety precautions, and each safety precaution is different for each oil. But
So
the general, yes,
Sabuhi is very clearly saying that, look, take it under supervision. Don't just take it willy-nilly, which means
yes,
don't just randomly take it. Please
yes.
take it under supervision. Sabuhi, stay around. You will enjoy what's going to happen next. Stay around. Thank you very much. And
Thank you.
lovely that this late evening you are there in Singapore. Thank you, Sabuhi.
Thank you.
Stay around. And now let's welcome our regular supporter from Prague in Czechoslovakia, who always supports us with the various conferences that he does. And he is going to tell us about World Council Congress that is taking place. Himself, Thomas, is a philosopher, a healer. He knows biotronics. He is very good at many matters. So Thomas came up with an idea to bring the medical people from medicine into alternative and complementary medicine as well, and now runs a successful conference. Hello, Thomas.
Hello, srdečný
Namaste.
pozdrav z Prahy.
I would like to give greetings to all of you from Prague.
Jsem šťastný, že tu mohu být s vámi a zaznělo tu mnoho podnětů pro naše zdraví.
I'm very delighted to be able to be with you here, and I have already heard many interesting ideas and incentives for global health here.
Brilliant. And Thomas, you are going to tell us about the World Health Congress that is going to take place, I believe, from 3rd to 5th of October this year. And many people can maybe still join online or still maybe come in person. Tell us more about that, Thomas.
Ano, to je pravda. A ten kongres má základní myšlenku: zdraví nezná hranic, hledejme, co nás spojuje, a je čas začít spolupracovat.
Yes, I can confirm all the information you have mentioned. The Congress will be held from the 3rd to the 5th of October. And its motto is Health Knows No Boundaries. Let's seek what unites us. And it's time to start cooperating.
Je velmi důležité, aby jsme měli dostatečné informace, a proto na kongresu vystoupí mnoho předních světových odborníků ze všech kontinentů světa.
It's very important to gain information, and for this reason we will be delighted to host numerous reputable, well-known TCIM figures coming from all parts of the world.
Významně zde bude také zastoupena Ayurveda, stejně jako v minulém ročníku.
And like in the last edition of the Congress, Ayurveda will be one of the most prevailing topics again.
Můžete tento kongres sledovat zdarma na odkazu, který vám dám do chatu.
You can all follow the Congress, watch the Congress, thanks to the contact which you will be easy to find on our website, which I will share with you. So you only need to apply for the link and we will send it to you. It's individuální ty linky.
Ano.
Si musí zaslat.
Budeme vlastně předcházet další velký kongres a ten se bude odehrávat v Rio de Janeiro.
And our Congress will be followed by another important event which will be held in Brazil, in Rio de Janeiro.
A doufám, že tady bude také navázána spolupráce mezi těmito kongresy. Vlastně už je navázána.
So I believe we will be able to establish cooperation also between these two congresses. We are already working on that.
Budu se tedy těšit na vaši možnou účast a budu doufat, že vám tento kongres přinese také něco pro vaši práci, ale také pro váš život.
So I will be looking forward to your participation in our Prague Congress, which is completely free of charge online. And I believe it will bring you some interesting ideas and incentives which will be helpful and beneficial for your lives.
So, Thomas, this is a perfect time to remind people that online is free of charge. It's a very good organization that merges medicine with alternative and complementary medicine. And Thomas, let's remind people the website. So it is WHC 2025 Prague.com. Very simple to remember. WHC 2025 Prague.com. And there you will see all the information. Is that right, Thomas?
Exactly.
Yes, it's exactly correct, and we can also share the website, the link to the website in the chat.
You please go ahead. If you can actually share screen, show your website. We allow you. Show your website, share screen, and bring your website on so people can know. While you are doing that, let's tell people Thomas has been doing this for several years. In 1999, he started an alternative method over there in Prague. He's very famous, known for this kind of thing. So he started Foundation BIT, and that was to do with Electronic Center of Social Support. So Thomas, you are a very important person for the community because you have given so much back to the society. And you can share the screen if you can just bring your website.
Yes.
I hope that it's already possible to see
Is there?
Yes.
Beautiful. So I'll just read it. It says the 4th World Health Congress 2025 in Prague, which is on 3rd till 5th of October this year. And look at the motto. It's very simple. Health knows no boundaries. Let us seek what unites us. It's time to start cooperating. And that's what we say at Healing Our Earth. If we cooperate with each other, together, we can build better communities. Isn't that right, Amrita?
Yeah, absolutely. Absolutely. That is the motto of Vasudev Kutumbakam. Together we can make a better community because the whole earth is one family.
And Vasudev Kutumbakam is basically one whole world is just one family. Because that's the whole purpose of it. And our Thomas, you can see from his smile and energy he exudes that he is not just a philanthropist, but he believes in bringing people together. Thomas, we are very proud of you. Tell us a bit more about this conference. Maybe you can scroll over.
Konferenci můžete klidně scrollovat dolů.
Tak, již před lety jsem pochopil, že mým úkolem je lidi spojovat a dávat jim možnost přístupu ke všem možnostem způsobům léčby.
Several years ago, I realized that it is my role to bring people together, to connect them, and give them various ways of treatment.
Nejdůležitější ze všeho je ale boží pomoc.
What matters the most, however, is God's help.
Je důležité nepracovat pro sebe, ale pracovat pro druhé ve smyslu lásky, která zde byla zmíněna.
It's very important not to work for oneself, but for everybody, in the meaning of love, which has been mentioned here.
Ano, mám svůj obor, který se zabývá energetickou léčbou a pracuji již 40 let.
Yes, I do have my own field of expertise, which is biotonics, a field of bioenergy therapy, in which I have been involved for over 40 years.
Ale to je osobní.
But this is personal.
Dnes je mi 72 let a doufám, že ještě nějakou dobu budu moci v tomto svém činění pokračovat.
I'm 72 years old, and I hope that I will be able to continue working in this field also in the future.
Jsem rád, že s vámi můžu jít touto cestou na tomto světě a jste pro mě také rodina, protože my všichni jsme jedno.
I'm very happy that I can continue walking on my path in this world, and you also belong to my family, because we all are united whole, which belongs to each other.
Můj první učitel byl Šrý Ramana Maharishi a pak Josef ze Zulka.
My very first teacher was Sri Maharamanishi, and after that it was Josef ze Zulka.
A těm bych závěrem své promluvy tímto veřejně poděkoval.
And I would like to conclude my talk with expressing my gratitude to both of them.
A to je vše.
That's all from my part. Thank you.
Thomas, on behalf of everybody at Healing Our Earth, those who are present here in the Zoom and those who are in the social media, everybody wishes you so much energy. Bring your smile, bring your energy, share the knowledge you have accumulated, and let's expand your work further and further, not just in Europe, but in all the continents of the earth. May Earth bless you forever. Amrita, over to you.
Thank you, Neil Kumar. Thank you so much. Thank you, Thomas, for joining in and coming over. And it's always wonderful. I also believe in the same goal of spreading the wellness word over, because we are one earth, one family. And with that aim, we all wish you a very best for the conference, and we will try that all the professionals given their best to have great sessions, great interactions, so that everyone can bring in their best to give to the world. Thank you.
And
so much.
Amrita, the main point that Thomas brought, don't do it for self, do it for others. Because when you do it for others, you become powerful spiritually, philosophically, socially, and culturally. And Thomas hit the nail on the head. Another person who does it for the people is our Fiona. So let's say goodbye to Thomas and bring Fiona in, and over to you, Amrita.
Thank you. Thank you so much, Thomas, for joining in. It's time to move from Prague to United Kingdoms with our lovely Fiona Clark, who is a energizer and zenergizer. So basically, Fiona is an energy healer as well as works in the holistic health with energy healing. And she has a lot to say about how we can cure ourselves and how we can heal ourselves, and what does our body talk to us about and how it responds. So Fiona, today's topic is also one of your expertise, where you have been working with a lot of people and you are healing people with energy medicine. And therefore, today as the topic is about joint inflammation, pains, and arthritis, a vast population of countries around the world are having this common issue, and especially the females also. They don't come to know what has happened suddenly and how it has occurred. How do you cure people and heal people? Throw some light. Over to you. Thank you.
Thank you. Lovely to see you all here. I know we're all in different time zones, different countries, and I'm in sunny UK, which is fabulous. So just to give you a little bit of a background, I trained as a kinesiologist back in 1991. And my core theme whenever I think about anything is what is the cause of whatever issue is going on? It doesn't matter what it is. So for me, it's not about treating symptoms. It's about understanding what is the cause of the issue that is presenting itself. And obviously today we're talking about arthritis, joint pain, which I know is a massive, massive problem with young people as well as older people. It used to be just thought of as an older person's dis-ease. I like to think of the body not in terms of titles. We can put a title to everything. I would rather say the body's either in balance or it's out of balance, because the body, we cannot just treat, and this is where I believe that people continue to suffer because there's only one aspect of the issue that's dealt with. We are not just physical beings. We have to remember this. It is so important. We are emotional, spiritual, mental, and of course, physical. We have a structural body, but we have an energy system, and we are energy, frequency, and vibration, first and foremost. So for me, I don't practice as a kinesiologist right now. I don't actually see clients face to face because I do everything on Zoom or I do it remote healing. So what I would say is joint pain, the two questions that I would always ask everybody when they come to me with a title of something, of an imbalance. And let's just be clear here. When you're out of balance, you may be stressed, you may feel pain, you may have injuries, you may have scars, you may have tattoos that have interfered with the energy field, your meridian system. So my first question is, how long have you had this for? And what was going on in your life before this issue started? Because emotionally, if we do not look at those emotions, you're missing that big picture. Because every single issue that we have on a physical sense has a very, very deep emotional connection. And this is where I see, a lot of people in the medical industry, they just look at the physical issues, and it's like, right, well, you need that medication for that bit and that needs that something else. We need to work with this first. We have to work with the mind and the emotions first. And that's what I do. And that's where I get very curious, because I do believe that we can clear our body of all dis-ease and we can be back in harmony. I truly believe that. I've seen it. I don't believe that we should sit in pain at all. That's my belief. And that is what I work with. I remember I got into this work 34 years ago because I'd had a car accident, and I was told by doctors in Harley Street in London I'd have to put up with the pain for the rest of my life. I had 2 whiplash injuries in that accident. I had one 3 months later. I had so much pain. I was in my 20s, and I found the kinesiologist who fixed my neck. I did not have pain, and the doctor was still telling me I was still going to have pain for the rest of my life. So this is why I came into this work, because I knew there was more. There's more to this magnificent body that is very intricate, intricately simple, but simply intricate. So whether we're looking at pain in the body in whatever sense, what meridian lines are actually going through that area, that's one question I'd be looking at in my head. What chakra system is affecting that particular part of the body? And if you don't have flow in your life, in the energy field, you're going to have pain because pain is congested energy. So we need to release the pain so that the energy can flow. Now, on an emotional sense, this is what I find quite fascinating. If you have that, what we want to call as arthritis or whatever itis you want to call it, I would be saying to you, okay, so where are you not flowing in your life? Because this is very much, joints are very much about how we move through life. Are you moving freely or are you feeling quite rigid? Are you holding on to anger and resentment from the past? Are you finding it difficult to forgive yourself or forgive others? Do you feel stuck? Do you feel limited? Are you worrying about making different changes in life? Because let's face it, the one guaranteed thing in life is change. And I know a lot of people don't like change. I love change. But it can bring up a lot of different emotions which get stuck in the physical body. So I would look at, where is this arthritis? Is it the fingers, the hands, the joints in the knees, the hips, the shoulders, wherever? Because that will give us another story. I use, just to give you a little idea, I've got lots of different energy techniques in my Zenergy chest. But one of the last 4 years or so, I've been using healing. I don't know if any of you know about frequency healing. This is a magical little box, 2 inches by 2 inches, which can basically scan your energy field. So it's scanning the quantum field, our energy field, to find out what are the causes on that emotional level. And this can go very deep. And sometimes we just don't know what they are because we're so stuck in the old patterns of our brains that we don't know what those deeper causes are. It will also send the frequencies into the body through the microcurrents that we put onto our wrists. Now, this works straight into the cellular level. And I've seen amazing things happen with Healy. I would not do without this. I use it for myself, which I have done for over 4.5 years now. I use it on animals. I use it on children. I'll use it on anything. So this is a phenomenal way. It's a German device that's mixing the ancient with this new science, which is where technology is taking us these days. Technology is just going into new areas, which it has been for many years, but let's just face it, we are just seeing more of what it's capable of doing in the open field. So I use Healy for everything. Mainly, I would be interested to see what are those blocks, those emotional blocks that are sticking in your physical body. Okay, so that's one thing I use. The other thing, and I don't know in India if you know about these tiny little patches. These are non-transdermal patches. It's LifeWave, and this is a light therapy. So photobiomodulation, they are non-transdermal. So they're not putting anything into your body. They're not a hormone patch. They're not a pain patch. But what they're doing is they're activating certain peptides or processes in the body so that it regenerates your body to heal itself. Now, these alone, we have 12 different ones. Just think about that little white patch. I think you can see it in the middle. It's almost like, just think of it as a signal, like a barcode. So when it goes onto the skin, the light and the heat of the body activates those peptides, which activate processes. So we have them for activating the stem cells, which by the time we're 60, a very scary thought. 90% of your stem cells are dormant. So how on earth can your body repair itself? It cannot. So we need to have the ability for the body to repair itself. And this is what this magical thing is doing. This is not new. These have been around for 20 years. So I use these, and I know of a lot of clients who have had a lot of knee problems. Knee problems seem to come up so much more than a lot of other things. And they have actually been maybe going off for operations to have knee replacements, whatever, and they have not had to because the pain has gone. So working with the state of regenerating your body to heal itself, working with the emotions, there is absolutely no reason why pain will just not go. So I'm very conscious of the time because I know I can talk to you forever, but I would like you just to really think more about what is it in your life that maybe is keeping you stuck. We are just light beings. We are energy beings. Where does your energy feel stuck? So just imagine lighting up your inner energy system so you can move with more flow, more freedom, and more joy. Because that is what it feels like when you want to feel into that sense of true vitality, energy, and happiness and fluidity, which is what joint health is all about. Thank you for listening.
Wow, that's lovely, Fiona. In fact, I wanted to ask you, how does a person come to know that which part of the body has a blocked energy? So suppose people have knee joint issue,
Yeah.
and how will a person come to know that the energy is blocked in a particular part of the body, and how can he or she heal using these devices that you have
Oh,
recommended?
there's so many different, that's a great question. What I would say, if somebody, for example, came and say, right, they've got knee problems, I would be saying, okay, is it the front of the knee, the inner side, the outer side, the back of the knee? Because I would be looking at the meridians. So you've got the bladder meridian that goes all the way down the back of the second little toe. You've got the stomach meridian that comes around the eyes and it comes down through the center of the knees of the second toe, not the second little toe. Then you've got the kidney meridian that's coming up inside the knee, and you've got liver meridian also being come up that way. Outside the knee, you've obviously got the gallbladder as well. So I'd be looking at those, and then I would be asking more about where are they emotionally? What emotions are really going on? Because then it's like putting a puzzle together and you're just putting the pieces in to find out the story, because our body tells a story. And that's all we're looking for, is what is the story?
Okay, that's very interesting. Dr. Anukul, you have been already in this field quite a lot of time, and you and me have been talking a lot about the same issue where you say the patients come with the pain and we have no answer despite of all the surgeries and so many things. What have you to say about Fiona's healing? And do you also believe that these energy meridians exist? And how do you correlate it with the modern system of medicine? Over to you.
Listening to Fiona, I almost went crazy. That's exactly how I feel like talking to all my patients. But I start wondering, but I have no idea how to do it. And here is the person who does it. Because I can see what she was talking about. Because I did my acupuncture training long time ago, way back in 79, 80. And she's talking about all meridians. I'm talking about chakras and how the blocked chakras can control your stuff. I'm talking of numerous other various systems. And one of my major studies when I was doing my master's in law, using my medical systems, was exactly that we all seem to work in silos. We all work in different spots. That actually prevents many people from getting the right treatment. And here it is Fiona, who is coming up with all those ideas, getting them all together and working for the whole thing. And that's fantastic. And I work at the very end of patients' care. Like patients have been to the pain consultants 2-3 times. They've been to various clinics. They've undergone surgeries, and some of them are no better. And they're complaining to the hospital that I'm not getting treated and a whole lot of stuff. And I said, I can understand it, but I do not know how to do it. And here is Fiona, somebody who I would love to have around to tell us how to go about doing it. I would love to really be with her practice just to see how she does it. And of course, I work as not only an orthopedic consultant, but I also work for the courts. So I land up all those with patients with whiplash injuries or negligence or delayed care and a whole lot of systems. And some of our orthopedic consultants simply say, it's all feign, it's all imaginary and a whole lot of stuff. I said, see, who are you to decide whether it's imaginary? The person feels the pain and that's about it. And then they say it is functional. I said, well, what is functional? We don't understand it. Thank goodness we say at least we don't understand it, but don't substitute by a word called functional. They say we don't understand it. So thanks very much, Fiona. It was very, very enlightening. I would like to know much more about it. If I can maybe join you maybe in your practice sometime for 2-3 days just to see how your system works. Thank you very much.
You're welcome.
Thank you, Dr. Anukul. Thank you, Fiona. Please stay around. We would like to have more chit chats and with you to know more and interaction with Fatima, our next guest. Global Namaste and a very good afternoon, Fatima. Fatima, you are a cancer thriver, an author, as well as multiple award-winning person, a TV personality, life coach, as well as a researcher. And in your lifetime, you have also faced a lot of things and come out of these to explore how the healing happens. And after listening to Fiona and going through all this stuff, and many life experiences teach us a lot of things where we follow the same trends of medicine doesn't work. It's something more than what it has to be explored by us. What have you lined up for all our viewers on this topic of how our pains are real pains or they are just
Hello
transitory?
and
Over to you. Namaste.
thank you. Hello and nice to be invited in such an event. Thank you for that. Well, Fiona was very right. She was absolutely right with what she was saying. All I can say here is that our body and our creation is much more comprehensive than we know. Everything works together. The body that we see, the conscious that we see, and the subconscious that we don't see, they work really hard together, but we never see the unconscious. All we kind of pay attention to is what we see. So I have a knee pain and that's all I see. But Fiona was really right, and she was giving it a good, credit how things work together. If you wanted me to start about arthritis, for example, I mean, yes, I can talk to you about my cancer as well. At some point, that was 10 years ago that I was diagnosed. But with the arthritis, again, it's very right what she said, that everything is so close and everything works together. They either work together or they don't work together. And if they don't work together, then we've got a blockage of energy somewhere and we need to find out and resolve it. Okay. With the arthritis, as a physio, what I usually tell my patients as a physio is that with arthritis, we've got, obviously, we've got a couple of different arthritis. One is that is very, very popular in UK is osteoarthritis. And that is where you lose a bit of cartilage, you're aging, not a lot of sun in here. So, and that makes your cartilage to go a bit rough and a bit painful. The first thing that you feel it is first thing in the morning, because the synovial fluid, which is the fluid inside the joint, kind of becomes like a jelly and is not easy to convert back to liquid, not liquid, but, to its form because of the cartilage being gone. So that's one arthritis. The other arthritis is the rheumatoid arthritis. Again, that is very popular in UK. But what I wanted to, if that's okay with you, Amrita, and all the other colleagues and, professionals, is that, yes, we know a lot about what we usually tell our patients, but I want to say something a bit different today. I'm going to go as a physio first, right? So my advice would be to patients to have 3 things in their mind. And these are the 3 things that are really, really important, okay, as a physio. So the first thing is keep moving. Keep that synovial fluid, that fluid in your joint, to be more liquid rather than a jelly, okay? And that works better for you. So that's the first thing. What sort of exercises is better for me? Of course, the more stationary the exercise, the better. The more strengthening exercises, the better. Say, for example, I just post some knee exercises for arthritis in my page the other day, and you can see a bit of a weight on my ankle. And that is strengthening exercises are proved to work for arthritis better than, say, for example, running on the treadmill, okay? Posture, making sure that the posture is more of an upright posture, because that flexibility of the spine and other joints could have been affected by the arthritis. So I know it's going to be harder to keep upright, but it's best to kind of bring that format to your life and encourage the muscles to work hard, because that's what they have to do, okay, to move your joints the way it was before. And pacing. Not many people talk about pacing, unfortunately, but pacing I think is very important. And the reason for that is so that you don't exaggerate yourself and you don't run out of all your energy and, you know, good muscle strength in one day that you're feeling good and nothing is left for the next for the next few days of the week. Does that make sense? So you do as much as you do in a good day as you would do in a bad day, so that you don't tire yourself out. You have like a routine for yourself. So these are the kind of advice that we give our patients as a physio in UK. But something that worked with my own cancer, and I always, as a transformational coach, I always ask my client to look at themselves as a whole rather than just the body. Okay, and how do you do that? So you've got this thing which is called consciousness, okay? And you've got this massive part of you that is unconsciousness, so subconscious. So you don't really see it, but it's there. It's your mind. It's how your energy work. Okay, I'm sure that is related to what Fiona was saying from another angle. So a lot of research have shown that you can do things. I mean, this is unbelievable. But listen to me. You can strengthen your muscles without going to the gym, without even doing an exercise. Not that I am encouraging you to, but if you're in so much of pain and you can't really go to the gym, you can't do any exercises, there is another way. And that way is that because of the pattern of your movement in your younger days are kind of stored in your mind, you can ask your mind to help you to bring those movements back. This is the simplest language I can explain this. So that means you are asking your mind, because your mind doesn't look for things to achieve unless you kind of have that relationship with it. I know it's a bit difficult, probably for people who are listening to this for the first time. But if you do 7 minutes of just before falling to sleep and 7 minutes when you wake up in the morning, that's the best part of your subconscious being around you, okay? And having that conversation with you. If in that moment, within that 7 minutes, you do exercises in your mind, so you just close your eyes and you see yourself, for example, doing this, right? Okay, and it has been proven that this exercise in your mind without even doing it is going to increase your strength by 36%. This is crazy, I know. All the evidence is there, all the studies are there. Obviously, it's not a place for me to go through those studies at the minute. The time is very limited. So why not using that kind of technique, you know? Just to help yourself from another perspective rather than being so physical. Why don't you become a bit more mental and do mental training? So we have physical training, fine, and I love that, okay, as a physio, obviously, but at the same time, you can do mental training, which means you can just purely connect with your subconscious and do the exercise in your mind without even doing it physically, and that will strengthen your joints and your muscles, okay? So that's one thing I wanted to go out of the physio perspective. And the other one is your diet, the food you eat, because arthritis is very related to, as you would know, inflammation in one joint or more in your body. So to bring that inflammation down, I'm sure, I mean, I have got a lot of Indian friends and, you know, Eastern friends that they do use a lot of spices. And I know you already probably do that, but things like ginger, things like turmeric, especially if you add a bit of a pepper to kind of enhance the curcumin result, is going to help you with a bit of a honey. just make sure that you keep your body warm and from outside and inside. So it's not just the weather being warm, is that warm nature that you want within your body, and that is the spices I just told you. So myself, most part of my cancer treatment was imagination. Visualization, just what I told you. And I didn't know at the time what I was doing. I was just led to do that because of a technique that I had used. But basically, this is how it works. So all the study came afterwards. I cured my cancer, and then I understood what I did by the study. But that's as much as I've got to say, to be honest. I don't know if you've got questions for me. No question?
I have a question here.
Yeah,
I think
go on.
how you are providing this particular care for many of the patients. Many of them, I understand, would be the NHS patients as well.
Yeah.
And how do you sort of provide how do you provide the information to them on a private basis, or you want to provide them in the normal clinical practice itself?
That's a very good question. We do a lot of different things as NHS practitioners and non-NHS practitioners. I know where you're coming from, and I understand how difficult that would be. But at the same time, there are studies there. Everybody's talking about them. It's not like you had an experience yourself and you're just sharing it with others, which I think that would have been, obviously, that's very credible as well. But at the same time, there are tons of studies about mental training, and you can find them online, no problem. If there is any questions with regards to that, you can probably DM me and I send you some studies. Maybe that would help for you to use as a practitioner and guide your patients. And also because of me having, not as a physio only, working as a transformational coach, which means you've done mental study as well as not just physical study. I think my hands are a bit maybe open. I don't know if I answered your questions or not.
You certainly have, but what is still more interesting is you have touched on some very, very important points about, and I also I do incorporate certain things like autophagy and microbiomes, the nature of food, and also the type of use. You said about pacing. And one of the best things I liked about you was because it sort of substantiated my thinking, because I've always worked as surgeon. So we work for anywhere between 8 to 12 hours of operating continuously. So it was all physical work. I never used to have anything to eat in the morning, and I've all the time sort of lived all the way like that. But since I've been doing lots of medical legal work, I've got thousands of pages of going through my documents. And I hate being able to sit for a long period of time and doing only this kind of work. But I keep on telling others, they said, do you go out for any exercise? I said, interestingly, I do at least 100 kilometers of walk every day sitting on my chair. So, so
you can do that.
This is for the time. So despite that, I'm sort of keeping it. I feel exactly the same. I feel energized and I want to go. Given the chance, I would keep walking. But anyway, thanks for beautiful information for everybody to take.
No problem at all. My pleasure.
I have a question, Fatima.
Yeah.
Perfect. First of all, Dr. Goswami, I want to learn how to walk 100 kilometers sitting. Okay. If I can crack that, I've done it. I'm very happy with that. Okay, Fatima, my question to you would be very quickly, I see what you're doing. I see how you're trying to do the mindset and the therapy that you're providing as a physiotherapist. Say a typical knee patient came with osteoarthritic changes, just a scenario. How often would you actually want to see that patient? How often do you train their mindset? How often do you do physical therapy on them? Or how often do you do just recommending exercises to them? Because obviously this is something that is progressive, and how do you look after it? In a nutshell.
Yeah, that's great question. That's absolutely great question. Okay, the way I do it,
yeah,
I usually approach them. First of all, I think it's very important, the energy, the belief that you have yourself, because obviously that vibration is going to, show your patient how you can look after them. So for me, I think my energy, my kind of work for them starts from very beginning. So I go through options with them and I see what lifestyle they have. If somebody tell me that she's in the gym all the time, they are, I don't know, usually my kind of patients, they want to be very supple because they are business owners, you know, they can't leave work and stuff like that. So within that aspect, you would expect them, somebody with that mentality that is running a big business, to have some sort of integration between the physical body and non-physical body. So I usually ask them, I usually, you know, ask questions that it would show me as a coach, how much they believe that there is another thing apart from the body. And then I usually go that way with them. If somebody comes to and say, "Oh no," I mean, I had a very kind of, you know, wealthy guy, and he was an engineer, and he was like, "I only believe what I see." So I was like, "Okay, no problem. Do this exercise, this, and that worked for him." So for me, I always say to my patients, I have a lot of people who I teach to become, you know, to have a good mindset, to be positive, to treat themselves by the side of what they do from this, you know, from the doctor. So they are doing the treatment, chemotherapy, whatever it is. And I always tell them, what you believe is going to help you, it will. So if you believe that walking from your chair, sitting there, and 100 kilometers you've done a day, you had done it. I mean, we are that comprehensive. If I ask you, can I actually, I don't have time, but can I just ask you something? Can I ask everybody, right, to just close the lips, not saying anything from their lips, okay? But in their mind, they just say, "Oh my God, I feel so good." Can you all do that in yourself without using your lips? Yeah? Did you say that? Did you hear it? How did you feel? You felt a bit of giggle? How did you hear that? You never said anything. Does that make sense? You never used any physical part of you, but you still said it. You still heard it. And if I continue to say that, "Oh my God, I'm feeling so good," in my head, without even moving my lips, I'm just going to be buzzing. That's how the energy works. Yeah? Thank you. Thank you. Any more
Absolutely.
questions, guys?
That's very wonderful, in fact. And I think this kind of optimism that we bring in our life, in our day-to-day lives, to have a small tagline of positivity, some aromas that keeps us positive, some flowers and blooms that gives us so much of positivity in life, I think we can make a big difference. Thank you so much,
Absolutely.
Fatima.
No
And
problem.
Dr. Lalit, it's always wonderful to have you with me to discuss so many things, because it's one of your fields as well as one of your interesting topics as well. A global namaste to you, and it's time to move to India with our next guest, Dr. Vijay, who is a professor in Ayurveda of community medicine, and he has been practicing as well as teaching in the field of yoga as well as community medicine. Being a professor, he has been working to let people know how does the ailments like pains, arthritis can be cured by the work of understanding on ourselves as well as believing in Ayurveda. So, Dr. Lalit, it's time to go to India and welcome our next guest, Dr. Vijay. Global Namaste and a very warm welcome.
Global Namaste, Dr. Vijay.
Global Namaste, one and all. Let me share my slide. I'm audible, sir?
Yes.
We can hear you.
Yeah. So your topic of today is about the discussion on arthritis and the cures through that, and how Ayurveda can heal. So could you please
Yes,
maximize your screen?
yes.
And the lifestyle
Shall
we
I
can
continue, ma'am?
adapt. Yes, please. Over to you. Thank you.
Yes. Once again, namaste, global namaste to one and all. My topic today, I'm going to talk about diet and lifestyle in arthritis. I'm going to talk more about Amavata. The symptomatology can be correlated with rheumatoid arthritis. So I'm limiting myself to rheumatoid arthritis. At the outset, I thank all the International Organization of Integrated Health, especially Dr. Amrita, Dr. Bhairav Kulkarni, and all the Ayurveda lovers from the globe. Thank you, one and all. Let me start diet and lifestyle in Amavata, that is rheumatoid arthritis. I am Dr. Vijay B. Naglur, professor and head in the Department of Postgraduate Studies in Swastharuta and Yoga, and I am running my own clinic, that is Pratham Clinic in Udupi, Karnataka. Let me start my presentation, the outline of my presentation, introduction, Amavata, the management principles, and diet and lifestyle principles in Amavata, and what are the do's and don'ts, and at the end, the conclusion. To start my presentation, before starting the diet and lifestyle, we should know Amavata. As I know that Amavata, where the vitiation of Vata and accumulation of Ama, that is toxins, takes place in the joint. Okay, so that produces Amavata. The symptomatology can be correlated with rheumatoid arthritis. It's autoimmune disorders, inflammatory diseases, where we need to take care about diet and lifestyle. That's plays an integral role in order to prevent as well as in the management of Amavata. When you go through this, the Nidanas, the causative factors for Amavata, the few factors like Mandagni, the metabolism, lack of metabolism, or what you may call the digestive fire will be less. And those who eat more snigdha, unctuous foods, viruddhahara, incompatible foods,
So, Dr. Lalit, his signal is very poor and fallen down.
Yes, I
Maybe
noticed that. Yes.
we can just chit chat. So Dr. Lalit, let's introduce you to the people. You are a senior chiropractor here running your own practice. You are also a mentor and a coach. And of course, at Healing Our Earth, you are the official reporter, a roving reporter. You go to different countries representing as an ambassador of Healing Our Earth. And from a chiropractic point of view, we see on a Facebook regular presentations of yours. Isn't it amazing that people are talking about arthritic pains and joints and pains?
Absolutely. First of all, keep more praising about me coming up because I love it.
Yes, but they're all true, isn't it, Amrita? Vijay, what you can do, Vijay, switch off your presentation and maybe video. You might be able to speak. Your bandwidth is very low. So Vijay, if you can remove your presentation, please. Otherwise, you are locking the screen. Vijay, if you can remove your presentation, please. Okay, let me see if I can force it out. So there we are. It's back now. Vijay, don't share your screen, please. Thank you.
Yeah, let's have chit chat.
Yeah, he can come and chat over here. Vijay, you can chat. Your bandwidth is low. Vijay, unmute yourself. You can talk to us. So Vijay, I like the Pratham Clinic. Pratham Clinic, the first clinic. I love that. And let us actually talk on the PowerPoint. It's good if there were students here and everything. Let's give the consumer knowledge, how people can benefit. What are your tips from spice or food that one should not eat during joint pains?
Okay. So when you talk about especially apatyas. You're talking about apatya, right?
Yes, maybe if you talk in
Yeah,
English,
contraindications.
yes, if we translate into English, because the
contraindication.
audience are not all Indian here, they are different countries. Okay.
Okay. Especially when you talk about the, what you may call the snigdahar, unctuous food, more, the vata and the kapha dominant foods, that is heavy for digestion, like what you may call nowadays the processed food, fast foods, that's heavy for digestion. So such type of foods are absolutely contraindicated during this Amavata condition.
Vijay, sign off and sign back in. When you join in, make sure no other Netflix or any other instruments are not open on there. You might be better. So sign back in. Over to you, Vijay. If you sign out and sign back in, over. Right. So
Am I
while
audible?
Vijay is signing back in, Amrita, you and Lalit can talk over. I'm going to pass the host to Nishit, our technical director here temporarily. We're gonna enjoy. People are enjoying because we are actually talking about something that affects everybody, and Anupul particularly mentioned, and Lalit also mentioned, because joint pains, arthritis, because people are living longer, applies in every country. And when Julie comes, from Italy, she will support that idea to us as well. Shortly, she will be joining in as well. So, Lalit, Anakul, Amrita, what tips can we give at a consumer level, either what not to consume during pains, or what to consume or what to do during joint pains? Over to each three of you, and may I wish all of you a very good and a lovely episode.
Thank you very much, Nil Kumar. Sorry, Dr. Amrita, go ahead.
No, I just wanted to thank him as you. Yes, please.
Wonderful. So, Dr. Anukul, do you want to go first?
I think when it comes to dietary stuff, I normally usually advise people on 2, 3 simple things. First of all, avoid all processed foods. Processed foods, a majority of our shelves in the supermarkets are full of processed foods. I said, have a look at things, try to get as much of good vegetables, fruits, and things like that. Avoid taking of this, usual loaves of bread which are there for weeks and they look very fresh all the time. They are not the best of fruits that you can have. Avoid too much to carbohydrates if you can manage. Try to have. So although not normally available here, but I'm a big lover of millets, and to be taken a particular time in a particular way. Then I also talk to them about microbiomes and how you can have well-made yogurt at home and have it, rather than trying to buy it all from the markets. Then also think of whatever food you're having, the food that you may be having may be full of various kind of chemicals, antibiotics, and other kind of stuff. So usually I say if you're having a non-vegetarian food, stick to fish and things like that, simple food, or otherwise stick to vegetables, avoid carbohydrates, avoid sugar, and that's where the things are going to be better. But at the same time, various other things to be taken.
Sure. Yeah, I think dietary advice is very, very important for people or patients suffering from arthritis. I just wanted to bring a quick statistic over here. And this is slightly a 5-year-old statistics, and I'm sure the statistic has gone much higher. 10 million people in the United Kingdom suffer some kind of arthritic pain. Okay, now if we look at arthritis, arthritis is a broad term. It's the umbrella word. Arthra meaning joint, itis meaning inflammation. Now, in this broad title of arthritis, it's inflammation of the joints. There's 2 major categories that comes out as rheumatoid arthritis and osteoarthritis. In simple words, rheumatoid is the more severe one, which is in your blood. And the osteoarthritis is something that you, I, and everyone on this planet will suffer some kind of osteoarthritic symptoms. It is what is commonly referred to as normal wear and tear or degenerative changes, which everyone who possesses a human body that has got many, many joints are going to go through that. So osteoarthritis is the most common arthritic pain that one would be experiencing. Now, the two most common symptoms, I would say, for sufferers of osteoarthritis are lack of movement, which is joint stiffness, and the second one is pain. Pain that they may describe as an ache, a stiffness, a swelling, and inflammation, things like that. So the two most common are obviously restricted joint movement and pain. Now, when that comes in, obviously, one has to use the proper diagnostic criteria to find out where the joint is going through that. A blood test and x-rays are usually the first line of testing procedures. And then there is multiple advice given for arthritic joints. Now, as Dr. Anukul was saying, the dietary advice is vital because you are what you eat. So exactly, I think dietary advice is vitally important when you're treating any arthritic pain, the aches and pains. But equally, I think what the two former presenters like, I forget, it's Fiona and Fatima mentioned that there is absolutely motion, mobility, which is vitally important. And I use these two terms of dietary advice as you are what you eat and you lose what you don't use. So if you're not going to use your joints, you're going to lose them. It's as simple as that. So exercise, from what Fatima said, from what Fiona said, are so important in rehabilitating the joint and long-term managing that joint. And I also feel one thing, that motion, this is another third statement that I'd like if whoever is listening to this, take it home. It's basically motion is lotion. So that is how the more you move the joint, the more lubricated you get it, and the easier the joint moves. So these are the three statements that I highly emphasize with my patients when they come into the clinic: is you are what you eat, you lose what you don't use, and motion is lotion. And this is one of the typical 3-point advice I give to my patients when they come with arthritic aches and pains. Yeah, it's a very interesting discussion because there is so much. I mean, all the wonderful speakers that have come on board for Healing Our Earth today have their own unique way of treating these conditions. So you can imagine that there is multiple ways arthritic joints can be treated. Dr. Anukul is quite heavy on dietary advice. Dr. Vijay, who's going to be talking about yoga and supplements that you are so natural. I will come as a chiropractor and I will say, aha, my field requires definitely movement to the joint, and where I come in with certain amount of physical manipulation given to the joint. Obviously, that happens after a thorough examination is done, x-rays are done to make sure that there is no damage being caused by physical manipulation. So physical manipulation is where my direction would go and say, aha, I would take into consideration the diet, the exercise, but where can I go in and actually work on the joint to make the patient feel a lot better? Now, Dr. Vijay, I 100% agree with your upcoming talk about yoga, because I am a firm believer and firm practicing yoga person that I know how my joints get very supple. So yoga is one of the things that I also highly recommend for patients' joint flexibility.
Yeah. Dr. Anukul, let's listen to Dr. Vijay, what he has to talk about yoga and the lifestyle tips. So, Dr. Vijay, over 5 minutes, can you quickly tell us about your expertise, how to deal with arthritis?
Okay. Thank you for once again. So I would like to brief my presentation within a 5 minutes. So my topic exactly the diet and lifestyle modification in rheumatoid arthritis. The first and foremost, you need to correct metabolic imbalances that balance Agni, that is digestive fire, to prevent armor that lodges in the joints, causing pain and stiffness. So encourage a light, warm, easily digestible diet. Avoid heavy, cold, oily foods that increases kapha and vata imbalance. The first point. The second point is reducing the inflammation and pain. Aim to decrease the joint swelling, tenderness, and stiffness. Use anti-inflammatory foods like what you may call the omega-3 fatty acids. Use spices like turmeric, ginger, green leafy vegetables, which are boiled and cooled. Avoid aggravated foods like processed foods, what you may call the fried fruits, red meat, and alcohol, and maintain the healthy weight. The third point. And when you come to the fourth point, enhance the joint mobility. Sir is rightly pointed. Promote the flexibility, strength, and range of motion. Regular low impact exercises. Some of the few yogasanas which are highly recommended in Amavata, that is rheumatoid arthritis. And the fifth point is prevent the progression of disease, the slow cartilage degeneration and bone damage, and strengthening the muscles and ligaments around the joints. And the sixth point is improve overall quality of life, like reduce the fatigue, anxiety, and depression, which is quite linked with the chronic arthritis, support a better sleep, correct lifestyle. When you follow dinacharya, rutucharya, and yoga, so meditation, that's having a wonderful effect. And coming to the last seventh point, the immunity plays an integral role here. So as it is an autoimmune disorder, so it includes immune modulating foods and vegetables and fruits and spices are highly recommended. And the more important lifestyle is stress management. We need to come out from the stress. That's a very important point. So in order to say brief, okay, that when you talk about the diet, some of the preparation you can do with what I may call the green gram soups, the horse gram soups having wonderful effect, and spices like, the turmeric, ginger, garlic, cumin, ajwain, having a wonderful effect because it enhances the digestion, that is metabolism, and reduces the armor. And some of the regular exercises is highly recommended, and some of the preparation you can do it in your in home in your kitchen, like you can prepare a panchakola fanta. That's one among the beautiful wonderful drug which is recommended for rheumatoid arthritis. And ardraka panaka, what do we call the shunti ginger decoction, you can prepare. Some of the soups you can prepare, that is the horse gram soup and green gram soups. And more interesting point, the buttermilk, the medicated buttermilk, because you can add shunti, pepper, that's having wonderful effect, that that enhances the digestive power, and it's having a light to digest. And one more interesting point I would like to say, that is one of the journals, that is IU journal. It was published that the therapeutic influence of some dietary articles on gut microbiota, that is gut microbiota in the pathogens of rheumatoid arthritis, especially what we call the medicated buttermilk is having a wonderful effect, especially in gut microbiota, by lowering the inhibiting the inflammatory markers. So that's having a wonderful effect. That is medicated buttermilk is having wonderful effect on, especially in rheumatoid arthritis. And some of the do's you can do, so eat light food and warm food which is freshly prepared. Use spices like ginger, turmeric, garlic, ajwain, hing, etc. To improve the digestion and the reduction of amavata. So use plenty of lukewarm water, sip by sip, So that's having wonderful effect. And little bit ghee that helps for lubricant, that act as a lubricant, and use preferably the bitter, pungent, and astringent taste. That is Katutikta Kashaya Aharas. That's having wonderful effect in rheumatoid arthritis. And coming to the lifestyle, upping a regular basis with especially Mahanarayana Thal and Dhanvantari Thal, it's having wonderful effect. So these are the few dietary modification is required in what we call in Amavata, that is rheumatoid arthritis. Thank you.
That's wonderful, Dr. Vijay. What are your recommendations that you recommended that people must take pepper or people must take ginger or medicated buttermilk? What is medicated buttermilk? How can they prepare a medicated buttermilk at home? And how much quantity do you recommend is good? Thank you.
Yeah, you can prepare, the green gram soup. Okay, so take a, what do we call the 100 gram of what do we call the green gram. Okay, and add more than 2 liters of water if you want, thin gruel or soup. Okay, so prepare it by adding Saindava Lavana and add some pinch of, the what do we call the marich and pipali, the pepper. Okay, long pepper, and what do we call the shunti you can add, that gives taste, and what do we call that's it's good for digestion of ama. And you can
What is
prepare
ama?
takra.
To our viewers, can you tell
Ama
us what
means
is ama?
so toxins, the toxins, undigested food you can call undigested food. That accumulation will produces the, what do we call ama. When you talk about rheumatoid arthritis, most of the people will think about joints, but Ayurveda gives importance for ama, which is there in the stomach. So if you correct your, what do we call the metabolism, or what do we call the digestive fire, or ignite the digestive fire, the half of the treatment you can get in what do we call in rheumatoid arthritis. That's the beauty of
Right.
Ayurveda. We need to treat this amavata in stomach rather than joints.
That's wonderful. So, what Dr. Vijay has to say is that arthritis is not just about the joints, it's about your gut, it's about your food, because ultimately, what you intake is going to get digested, will be producing either the healthy microbiomes or the toxic microbiomes. And then these toxic microbiomes may create toxicity in your body. And with toxins that accumulate in your body, which he says it is ama, can further aggravate the inflammation of your body, as well as can result in inflammatory joints, which you feel as pain. So, in order to cure that, there are a lot of good remedies that he has recommended, right from buttermilk to black pepper to long pepper, asafoetida, and the pink salt that you can intake in right proportion and amounts that will help you to heal from here. It's time to take our next guest, and we are very thankful to Dr. Vijay as well as Dr. Bhairav Kulkarni for introducing him. It's time to move to Julie in Italy, and let's welcome Julie. It's really wonderful, Julie, to have you over here. Global Namaste and a very good afternoon to you.
Thank you. Global Namaste. And I appreciate the opportunity to come back and speak to you all again. This is an interesting topic that's very near and dear to my heart. So I'm going to take this course. I'm a menopause coaching specialist, as well as a master health coach and a master herbalist. So I am going to be talking about this from the perspective of midlife women, because this is a population that tends to see a lot more aches and pains and diagnoses of arthritis. And I would just excited to dive
Julie,
in.
exactly. The idea to have you in today's episode is also to talk about menopausal arthritis. A lot of women
Yes.
don't know about it. A lot of women are unaware about what is happening suddenly at the menopausal stage. And sometimes these kind of arthritic pain may also creep up before their menstruations, in their cycles. And then all these things go just so unconcerned that they aren't even aware about it, neither does anyone talk about it, but still it comes up as a suffering and it becomes a trauma of their life, which they keep dealing on without getting a notice of that. So what
Yeah.
have you lined up for us to talk on menopausal arthritis and arthritis that comes up in this way and flares the body, and so many people, especially women, aren't aware about it? So over to you. Thank you.
Thank you. Yes, and it's really sad to say that in the medical system, women are more often dismissed by their doctors as being hypochondriacs. We just complain, we're being very dramatic or emotional about these things, but this is a real life situation. And most people think that pain or joint pain is just part of getting older, or that it means you have arthritis. But the truth is, not all joint pain is arthritis, and not all arthritis is inevitable. Lived through a number of different kinds of inflammation, so I understand what it feels like to feel 20 years older than you actually are. And over the years, both personally and in my working with clients, I have learned that our joints are messengers for our body. They're not just squeaking or talking to us because we're old. They're trying to tell us something really important. So when we say arthritis, as you've already heard many people say, we're talking about inflammation in a joint, but there are different kinds of joint pain, right? We might have structural joint pain that isn't because of damage to the cartilage or ligaments or even our bones. We might have inflammatory pain that's a result of our immune system kicking up and causing swelling and heat in places we don't normally have it. We might have metabolic inflammation, like something like gout, where uric acid crystals form and our kidneys can't process uric acid properly, and the crystals settle in a joint and it becomes very painful. We might have injury-related joint pain that could be from trauma, like a sprained ankle, overuse, or poor movement patterns. And that's something really common these days, as we tend to be much more sedentary. We don't really know how to move our bodies properly. So a lot of people are told, right, this is all wear and tear, but it could be one of these different kinds of inflammation. It could be because of hormonal shifts, as I'll get into in a moment, or even nutrient imbalances, as you've heard. But pain is often an early warning sign. So if we catch it early, even if we catch it later, we can stop it from becoming a long-term problem, and we can reverse it if we're willing to look deeply enough to get to the root cause. So in midlife, one of the chief drivers of joint pain is the drop in estrogen that women have. And even in perimenopause, so we're talking late 30s to early 40s, estrogen is fluctuating wildly. So we might be having aches and pains that we've never had before. Because estrogen isn't just a reproductive hormone, it's also a very powerful anti-inflammatory substance. So it helps regulate certain cytokines in the body, and cytokines are like chemical messengers that can ramp up inflammation in the body. Estrogen normally keeps it under control. So that's one of the reasons why joint pain often gets worse when estrogen drops in midlife. So these cytokines aren't bad. They're part of our immune system, but when we have too much for too long, we can have some of this damage to maybe cartilage or just making pain feel more intense. So also when estrogen levels fall, inflammation can rise, our collagen production slows, so all of our connective tissues that need this, and our joint lubrication decreases. Again, we're more sedentary, and we have all of this other inflammation going on in our bodies, so we end up feeling more stiffness, more soreness, and we do have a higher risk of developing osteoarthritis. So studies have shown this in postmenopausal women. Higher rates of osteoarthritis and faster progression of osteoarthritis. So this is about chemistry, not just about age. because menopause is a major chemical shift in the body. So once we understand that, again, we can start addressing it from the root. So something that bothers me is so many women just say or are told to just take calcium for your bones and joints. But it sounds simple, but the truth is that calcium without balance can cause as many problems as it solves, because most calcium supplements on the market today are very low quality and provide little to no benefit. You might as well go eat chalk from your children's classroom because it's about the same thing. Just like magnesium, calcium comes in many different forms, and some are bioavailable to us and some are not. And the other thing I'll emphasize here is that our bones are made up of a mineral complex that involves much more than just calcium. And without the right partners, meaning like vitamin D, vitamin K2, and magnesium, we can't transport calcium into our bones where we need them. And then when it can't get into the bones, it has to go someplace. So oftentimes it can end up in places you don't want it, like joints, like arteries, instead of where it needs to be. So if it ends up in places it doesn't belong, that's called ectopic calcification. And magnesium is a quiet hero here. Most of us are deficient in magnesium because our soils don't contain enough of it. It's involved in over 300 different enzyme functions in the body, everything from energy production to muscle relaxation. It helps your body use calcium correctly, and here's the kicker: magnesium and calcium can compete for absorption. So if we take a lot of calcium, we have a less than healthy gut. You've heard a talk already about how important your gut microbiome is. Magnesium can end up losing that battle. So you end up with magnesium deficiency, and which is also linked to more joint degeneration, believe it or not, and higher pain levels. So when we can find that balance, we can better reduce inflammation and keep everything moving well. So the other thing I see a lot of women doing is relying on NSAIDs. Now, I'm not anti-medication, but I am pro-information because I believe that medication should be the last resort. And I believe you should make informed decisions about which medications work best for your body because it's different for everyone. So non-steroidal anti-inflammatories, right? These are NSAIDs like ibuprofen, naproxen, some of these other things. If we need some kind of short-term relief, like that sprained ankle, they could be a good tool to use, but they were never meant for long-term daily use. And I know so many people who do, and they have risks with them. So gastrointestinal bleeding, strain on your kidneys, and increased heart attack risk with high doses over time. This is serious, especially at a time of life when women already have an increased risk of cardiovascular disease. So I think about taking NSAIDs as a long-term fix, kind of like turning off your smoke alarm without putting out the fire, right? It may quiet the noise so you can think straight for a minute, but your house is still going to burn down. So relying on these things for long-term is not a good approach. Instead, I believe in a 4-pillar approach. We call think, eat, move, and live. And think, as you've already heard, mindset is absolutely critical. When we can focus on the way we think, whether you think that's mindset, perspective, attitude, whatever you want to call it, your subconscious mind is very, very powerful. And when we don't know how to manage our stress, when we are talking to ourselves negatively constantly, we have this open loop of stress hormones flooding into our system. Think cortisol and adrenaline. And these are inflammation producing chemical messengers. And our bodies were always meant to close that stress loop. We flee the emergency and then we go back into balance, into rest and digest mode. When we're constantly stressed because we're overthinking, we're worried, we're focused on all the bad things about ourselves or our lives or whatever's going on, that stress loop stays open. And our body is going to shunt blood away and processes away from things that it needs to do, like digesting our food properly, like repairing and rebuilding tissues. So how we think is really critical. And doing things like meditating, breath work, anything that's going to help us manage our stress. I consider stress to be the #1 enemy of women in midlife, probably of people around the globe generally, but especially during midlife. Eat, the second pillar, You've already heard this, eating anti-inflammatory foods, absolutely essential. My doctor used to tell me you shouldn't have to learn how to read food labels because your food shouldn't have labels. And while in an ideal world that would be true, we can look at least having more whole foods in our diets, leafy greens, nuts and seeds, beautifully colored vegetables, omega-3 fatty acids in our fatty fish, and then herbs and spices. You've already heard again, turmeric and ginger. And magnesium-rich foods, as we said, legumes, everything to balance our calcium, to support our muscles and joint health and lower that inflammation. Movement, daily movement, absolutely. It's going to lubricate your joints. Juicy joints are what we like to see. Even 10 minutes makes a difference. For women in midlife, strength training is absolutely non-negotiable. We need it very badly. And I will tell you personally, throughout my life, if I'm not exercising and strength training regularly, my pain levels go through the roof. It's the thing that keeps me happy. It's the thing that keeps me moving. It's the thing that keeps me sane. And I'm telling you, movement is going to be your very, very best friend. And then we get to the live pillar, and this is about all of the lifestyle factors like getting good quality restful sleep, staying hydrated, building connection and meaningful relationships, getting that human connection. And if you don't have a human to connect with, maybe you have a pet. These are all things that help also reduce stress, but we need that meaning and purpose in our life. And the one thing we really emphasize with our clients is small, consistent changes over time. That's what's going to create massive results for you. So you're getting a lot of information today, but don't think, oh, I have to just start doing all of these things all at once. You're best to think of what is the one smallest thing that you can do consistently on basically a daily basis. Do that. Once that becomes just part of your daily routine, then add the next thing. Because if you try to do a really big thing, you're going to start feeling overwhelmed. It's going to be hard to keep up, and you're not going to see the results because you can't maintain it. So those small, consistent changes over time. So what are your joints trying to tell you? Maybe it's you need more movement. Maybe it's you need better fuel. Maybe it's please, please manage your stress. I do have to take exception to one thing that I can't remember who said it about you are what you eat. I would argue that you are not what you eat, you are what you absorb. So taking care of your gut, stress is a major factor in gut health. If you're eating a really great diet, but you're stressed beyond belief and you're not moving your body, you're not going to create the conditions for your gut to absorb all of the good stuff that you're putting into your body. Food and movement and lifestyle first, and then look at supplementing with things that your body needs that you're not getting from those other sources. Joint pain isn't just about wear and tear. It's a number of different things, especially in midlife. So I would love to chat with anybody who's interested if they're in this position in midlife. This is what I do and what I love doing. And I hope that you will come in and speak with us because the sooner we listen, the sooner we can move freely again and feel good in our bodies. So thank you.
Thank you, Julie. That's so wonderful. In fact, what you have said, we are not what we eat, but we are what we absorb. And that absorption has so much to talk about because absorption phenomena, metabolism, excretion, everything is interrelated with a lot of things in relation to your diet, with relation to what you think, how you feel, or what you consume as a stress in your life, and what are your daily lifestyle tips. So coming to that, what are your advices? Can you recommend our women 5 best tips that they can follow during this menopause and think about what is beneficial for them for curing these kind of ailments?
Absolutely. Yes. I think number one is manage your stress. Find a way to set those boundaries for yourself, find a way to, and one of the beautiful things about stress management is that it can involve lots of these other things that I talked about. It can, maybe you find you feel really good after a walk, or you feel really good after an exercise session. So you're getting movement and stress management all at once, but managing stress, number one, because at least it will calm your body down so that you can feel what's actually happening. Number two, stay hydrated. Please stay hydrated, because a lot of times our joints get stiff when we don't, they need liquid. Every cell in our body needs water. So when we're properly hydrated, a lot of that you can get from your food, the rest of it you have to drink. But when we're hydrated, it even helps our brains function better. And brain fog is a big symptom in menopause, but especially for our joint health. Number three, prioritize sleep. That's really tough to do in this stage of life when sleep can be disrupted by hot flushes and night sweats and those kinds of things. When we set good sleep hygiene, so we go to bed at the same time every night, we have a good environment to sleep in, we put our screens away at least an hour before bedtime so we're not flooding our brains with all of that blue light. Priority sleep gives our body the chance to rest and rebuild and restore. What is that? 3. Number 4, I would say find your purpose, because a lot of women get so caught up in doing for everyone else or just going through the motions of what they feel like they are supposed to be doing. They forget about who they are. And if we can't be our best selves by supporting whoever that is, whatever that is for us, it's hard to live an energetic, vibrant life. And again, we are all energy. And you know what it's like. You walk into a room and you can feel another person's energy. We want to be the one to bring that up, but we have to do it for ourselves first, because nobody else can do that for us. Right? So that meaning and purpose. And number 5, I think relationships, because that social connection, we all learned that during COVID, didn't we? That isolation caused so much difficulty for so many people, having those relationships. And again, if you don't have family, or you don't have people around you. I mean, my husband and I live away from everyone we know here in Italy. So we spend lots of time together with our dog. We try to get to know our neighbors. We go out into the community just to be around people, because just having that interaction, I think, can really help us feel uplifted, especially on days when we don't feel like that.
Amazing. That's nice. That's nice, Julie. Dr. Anuku, yes, over to you before we take up our tips from Dr. Lalit. Yes.
Thank you very much, Julie. That's a very nice set of information. I have got, my job is relatively easy in my clinic straight away, because as a surgeon, I can say my job is very simple. I question myself, can I use a knife and sort it out? And the answer is no. And but I give exactly the same information that you gave. But I have one question which is often asked to me by many of the patients, in the middle-aged women particularly. I'm taking cholesterol-reducing drug, various kind of statins. I'm taking hormones. I'm taking estrogen tablets. And should I continue taking the estrogen tablets? I'm also taking something for my osteopenia. And I know that they can, hyaluronic acid and things like that, they can also increase bone pain. So I often remain a bit sort of, I said, yes, your blood is all. So you just have to tell your doctors, maybe cut down one medicine and see what happens after that. What would you advise as a person at the other end when you're treating the patients conservatively and advise them appropriately?
Yeah, ideally we get to work with someone's medical team, because I think that coordinated care is really essential. I think those I've forgotten the category of drugs for
osteoporosis.
Osteoporosis, but those drugs are so terrible. They're so bad. I mean, they had women that caused spontaneous fracture of the femur. They're the jaw necrosis that dentists don't want to work on them. I don't understand how they're still around, but it's not my place to tell someone to stop taking a medication, but especially statins and that category of drugs are actually quite toxic for the body. So working with a team and working on lifestyle factors, working on dietary factors, which is what we're able to do. My business partner and I also are qualified to do functional blood testing. So we can get a much better picture than the standard blood test that they're getting from their doctor. So if they're willing to make that investment, we can do the functional blood test, we can do stool analysis, we can look at what their gut health is like, we can look at a number of other factors. And especially for people who are having high cholesterol, that's not related to heart disease. All the research is there. So if we can show that, depending on the tests that they're getting, if we can show the full panel of blood lipids and other mineral and vitamin status of the body and other enzyme functions in the body, then we can also see, is the statin really necessary and can they be weaned off of it? Because those things can cause a lot of these symptoms. So it's not my place to tell them to do that, but if we can improve these other factors and get them invested in removing the medications, then we can help them advocate for themselves with their doctors. Because ultimately it's up to them to decide.
Thank you. Thank you.
Thank you. Thank you, Julie. Thank you, Dr. Anukul. Dr. Lalit, you being a chiropractor and giving so many good advices to people in terms of a lot of things, what are your takes for the patients who come to you with this kind of pains, and what do you think that what's right for them to choose as the first step to work on themselves the moment they feel their hands are aching, their joints are paining, they can't move at all? So over to you for next 10 minutes or 15 minutes. Thank you.
Thank you very much. Thank you, Amrita. First of all, Julie, I take your point. It's not what you eat, it's what you absorb. 100% agree to that. Because you could be eating everything and not absorbing anything. Thank you for correcting that. I take that point really loud and clear. And I'm going to change my statement now to you are what you absorb. So thank you for that. So Amrita, yes, you heard a little bit about what I said. Look, I'm in a primary healthcare provider space. So most patients who are coming to us, so these are my tips that I'm going to offer right now, yeah? So most patients that are coming to us are coming in pain. So the first thing we want to do is, how can we help them relieve the pain? So all the other speakers who've come so far have got amazing recommendations, dietary changes, gut changes, gentle yoga, exercises. All that is where I believe where you can actually go to the root cause of the problem and then maintain it with proper gut health, proper exercises, proper stretches, proper supplementation as it's needed. Immediately when they come in with pain, that's where my scenario lies. So what do? Obviously, after a full diagnostic criteria of x-rays, blood test, and physical examination and consultation, based on that information, I need to help them with pain. So again, I'm not a very big advocate on medication. It's needed when it's needed. But most times, like where you're just popping in an anti-inflammatory or a painkiller, you could do a lot more conservative care for that rather than ruining your gut. So that's where I say my job comes in to say, okay, let's do some mobilizing, where is hands-on therapy, joints that have actually become quite stiff. Make sure you mobilize them to the extent that they are tolerable with physical pain that they're experiencing when we do the treatment. There are certain devices that we would use to stimulate the joint. We've got certain devices that are like pulsating devices. What we have is an instrument called Arthritis, which throws immediate pulsation to the joint to help the joint gain a bit of mobility and also momentarily block the pain pathway. So that's where we would use some modalities, use hands-on treatment, and sometimes what we do use is an anti-inflammatory gel, which is of a natural sort of source rather than chemicalized source. So there is something based in arnica, eucalyptus oil, that is again quite aromatic, but it absolutely helps the instant relief of pain. So we would either apply that for them in the clinic, or we would also recommend them to use it 3 to 4 times a day. Sometimes some of those joints are quite inflamed and painful. They might need a little bit of support system, so we may recommend a elasticated support to just help the joint stabilize a little bit. The third thing I would recommend, again, depending on the joint and the level of pain they're experiencing and the state of the acuteness that the patient is coming in with, we would actually physically manipulate the joint. So take the joint to a level where the anatomical range comes through, and then we just give a little thrust to the joint. That is where we increase the mobility of the joint. Now, what is the benefit and how can we sort of justify doing a physical manipulation? Well, physical manipulation is known to sort of produce 3 happy hormones in your body, as you call them. It's the oxytocin, it's the endorphin, which is morphine-like substance. And these are the kind of substances that help relieve your pain. Momentarily though, but it does. Now this is where gradually, with repeated treatment, with repeated mobilization, with repeated anti-inflammatory gels, these joints start getting better and better in its mobility. Obviously, as a part of physical therapy, that's what we would recommend. And then as beneficial with the dietary changes, yoga exercises, and any other supplementation is what we would then recommend them to either consult their sort of a naturopath or a herbalist, and then they can get that kind of advice from them. Obviously, I stick to my chiropractic side of it. I have little advice on dietary changes and supplementation that one would take, but we can certainly give them the basic information and then they can take it further. One thing I will reiterate what Julie mentioned was hydration. Keep yourself hydrated because more than 70% of our body is made up of water, and you need to use and replenish that and create natural and fresh water supply to your body, because otherwise that also starts giving you joint aches and pains. So in a nutshell, exercise and stretches is yes something that we recommend. We recommend an anti-inflammatory a gel. We would recommend physical mobilization, physical therapy on it, whether it is hands-on and or assisted with modalities. So those are the kind of things that I would say would be my tip. One thing I would like to just finish off with the next couple minutes, and if it's open to questions, one of the arthritic conditions called psoriatic arthritis. And I'd like to bring this to the audience's attention because psoriasis may just appear on skin and people just related this as a skin condition. But in the arthritis branches that you see, psoriatic arthritis is a very common presentation and presents as back pain. And this is what I see on a very regular basis. People coming in with psoriasis on the skin immediately alerts me as a chiropractor to find out what the lower part of the back is like and the sacroiliac joints, which I'm going to just point down here. That's where they are, right at the belt line. The sacroiliac joints get affected with what we call psoriatic arthropathy. So arthritis can affect the joints that have got the arthritic changes. And if a patient is presenting with a skin condition, blood test would definitely prove it that the psoriasis on the skin, and the patient's also suffering from what they call psoriatic arthritis. So let's say some of the skin conditions are also related to joint aches and pains related to arthritic changes. Anyway, that's my little tip that I wanted to share with you. And if there's any questions, I'd love to entertain them.
I have a question to you, Dr. Lalit.
Yes, Dr. Anukul.
I do land up with many patients who have been to chiropractors, who have been to physiotherapists, and their knee joint pain or some joint pain doesn't get better. And I said, well, fine enough. Now, one of the things that always intrigues me is the fact that as a surgeon in our clinic, we are pretty happy in giving steroid injections. I said, it's very easy to give it. But in reality, you have to recognize what I'm actually doing. I'm trying to get rid of the inflammation alone, because many people have severe arthritis, but no pain. And that's a very subtle difference that you have to recognize, that patients have very badly worn out joints and yet no pain. And on the other hand, some people have very mild degeneration in the joint and a lot of pain. And obviously the question comes that if I give a steroid injection and the patient gets better, in other words, the steroid injection, which is being anti-inflammatory, all that you have done is actually cut down the inflammation. You have not done anything with the degeneration process. So in reality, you have to think very carefully about the cellular level of action and at what is happening at the subcellular level, and how you can getting rid of various kind of cytokines, prostaglandins, etc., like that in the subchondral bone. If I were to give that injection to somebody, how would you take that patient as somebody to be treated up, start the injection, or do you leave a few days and after that you start the treatment? Because I prefer that you stay away from any intervention for about 2 weeks, let it all settle down, and then let the chiropractor works or physiotherapist. But that is my way of thinking. Would you advise us accordingly?
Absolutely spot on, Dr. Anukul. Once the patient has had a steroid injection, it is best not to physically intervene. Let the steroid do its work. And yes, 2 weeks, 3 weeks, generally we recommend about 2 to 3 weeks time frame, and then they come in and then we can, as you said, steroid is only going to combat the inflammation. It is not doing anything for the progressive arthritic changes that they get. So that is where we say yes. For pain relief, go ahead if you need to, and if that's the only option available, go ahead and take the steroid injection. 2 or 3 weeks later, come back, because exactly what you said, we need to work on the arthritic change so that that doesn't get worse. And that is where mobility exercises, physical manipulation, mobilization will come in very, very handy as long-term management of the condition.
Absolutely. Thank you. Thank you.
Yeah.
In that case, I also wanted to ask you that most of the time people think that steroids are the best solution because it just takes away their pain, and later then they realize that it has created so many side effects. So in that case, what do you recommend, that tapering dose of steroid is fine, or the same amount of dose is okay, because they generally take to a level where that particular dose. So if they're taking 5 milligrams a day, it doesn't work for some time. Later on, they have to increase the dose, and then the dose increases, and that leads to a lot of toxicity. So what do you recommend, Dr. Lalit, in that case, that these doses can be decreased by adopting different kind of conventional systems that we work on? What have you reported or seen in your patients?
So number one, we have to make it very clear, and I think Dr. Anukul would agree with me on this, is to explain to the patient. I think when the patient's educated, they will understand. So number one, we've got to tell them steroid is a 50-50 chance. Whether it's going to work or not, nobody can tell. So if you take that injection and you get pain relief, wonderful. Because immediately when they're in so much pain, that's what they want. Explaining to them that that's all the steroid is doing is just relieving your pain. It's not touching your arthritis. You will need long-term management with different avenues. So when that situation comes, 2 options are given: alternative care, supplementation, and all the rest of the topics that we've discussed. And the option is also given that, hey, look, you may want to consider the tapering option and see how that works, because obviously you do not want to keep pumping steroids in them. As we all know, steroids do have a side effect. And again, educating, and the right consultant and the right practitioner will actually do that. Educate the patient that as soon as we can, let's go down on steroids and try all the other ways to help your joint. Does that answer your question, Amrita?
Yes, yes.
I was
yes.
to that. As you know, that when it comes to steroids and uses of these in various kind of arthritis, we have got various lines of treatment. It's not only merely we go from anti-inflammatory to what you call various other chemical process of treatment like methotrexate and things like that. And of course, we go to cellular level and also genetic level. So you go to at very different stages. So I leave that bit of decision to rheumatologists to decide, because it's a very specialized field. My more majority of purpose is simple surgical work and get on with it. But that's where people like Dr. Loda and all who really come into action and get our patients well. I don't know how they do it, but that's fantastic. Thank you.
लोढ़े के जैसे है लेकिन सोडा है.
So,
Yes, Nishit, let's have your viewpoint, and I would leave for a moment with you. Yes, over to you.
Yes, so Dr. Lalit, what a wonderful session. I wanted you to just re-establish for the viewers out there,
Yes.
how does spinal alignment affect joint health, and can misalignment contribute to arthritis or joint pain?
Absolutely. I like that question, Nishit. I didn't pay you to ask me, did I? No.
No.
I believe, as a chiropractor, you've hit my absolutely passionate topic that I love talking about, how aligned one's spine should be so that the other joints of your body are minimally affected. Now, the only analogy and example I will give you is, when you're driving your car. And many a times we hit the curb and the wheel gets a bit knocked and the wheel alignment goes and you are okay. There is no symptom, but the wheel alignment is out. We all know that. And repeatedly we hit the curb or something or the other, and the alignment keeps being knocked out. Over a period of time, you will notice that when you leave your steering wheel and you're driving, the car will meander in one direction because the alignment is off. Now, after a little while, when you go take your car for service, they say, aha, this part of your tire is more worn than the left side or the right. One of the sides is more worn. And you think, why is that happening? Obviously, the first time you knocked that wheel onto the curb, you knocked it out of alignment. So similarly, I use the car analogy with the human body. Every time when we bend, twist, lift, hit, anything that we do physically and get knocked, we are knocking our alignment out with posture, with poor posture, with usage, overusage, abusage of our body. We are knocking the alignment out every single day. And that is where, if the spinal joints or leg length discrepancy or any form of overuse on the joint is going to cause joint trauma. So misalignment will lead to that arthritic change. Repeated trauma is going to lead to that arthritic change. So yes, Nishit, to answer your question, alignment is vital for the whole body to function mechanically in a correct way so that we can minimize the wear and tear on each joint of the body. Not just the hip, not just the knee, not just the back, but including the 26 bones that you have in your feet. Thank you.
Amazing.
very good.
Thank you, Dr. Lalit, and thank you, Nishit. It's time to move. Thank you so much, Dr. Lalit, for having here as well as being our resident anchor and a contributor from this side. Is always a pleasure.
Thank you.
It's time to move from UK to India, and I would like to welcome our next guest, Dr. Yashashri Kulkarni. She is the director of Shri Siddhivinayak Ayurveda Panchakarma Center in India, and she has a great experience in dealing with disorders of joint and spine and its cure through Panchakarma. Global Namaste and a very warm welcome. Kindly unmute yourself. Good evening. Global
Good
Namaste.
evening. Global Namaste to one and all.
Yeah, Dr. Yashashri, you have been dealing with the conditions of body in relation to gynecology as well as joints and spinal issues. What are you sharing with our viewers on this topic today? Thank you.
Yes, thank you so much, Dr. Amrita. I would like to, first of all, thank you all the dignitaries present over here and Healing Earth platform who have given me the chance to express my views on the arthritis and the Panchakarma management through Ayurveda. So now coming to the point, as or osteoarthritis, because as I'm a practicing gynecological views more, so I'm going to check the patients, and I'm having the patients like degenerative joint disorders, and that is osteoarthritis. And regarding that, they are suffering from pain, stiffness, swelling, reduced mobility, and sometimes bone spurs may be there. And according to Ayurveda, it comes under Sandhi Gata Vata. That Sandhi means joint, Gata is lodged. That is, the Vata dosha has been lodged, or aggravated Vata dosha has been lodged uh, pathologically in the joints. As the pathology formed due to wear and tear of joints, as Dr. Lalit says, extra use or misalignment of our body joints and use of our body joints will allow there to uh, lodge the vata dosha, and it will cause again the wear and tear of that cartilage, and also the synovial fluid uh, uh, from that joint, and the condition leads to osteoarthritic changes, and most probably patients suffer with the stiffness, that is morning stiffness may be there, or reduced mobility to the joints. And for that, we are dealing with the panchakarma. As I'm running panchakarma center here, we are dealing the patients with the help of panchakarma, as Ayurveda is the science of Ayush Veda, that is means lifestyle management. As we are doing the lifestyle modulations, we have to think about the curative aspect as well as the preventive aspect of our joint or locomotion or our movements or throughout all our body. As before my presentation, all the respected dignitaries have explained what is exactly osteoarthritis or arthritic changes. Just I would like to focus on this, as the Ayurveda do the treatment with the root cause. That is, we are going to find the root cause of the disease, and then we move for the treatment or curation of that disease. So, going through the detoxification or the panchakarma treatment, first of all, we are having two types of panchakarma, as like local panchakarma or local detoxification or local management of pain, swelling, inflammation for the joints, and overall in overall panchakarma, that is detoxification from the internal aspect. Coming to the point for the internal aspect of the detoxification treatment with the help of Panchakarma, we would like to, we are going to do Basti. We do Basti with that patient. Basti is the enema treatment, as we are doing it with the Purva Karma, that is pre-procedural tricks, and then after the main procedures, and after procedures we are doing that is Paschat Karma. So first of all, we are going with Purva Karma, or the procedures which are dealing with preparatory modifications of the body. We do oleation with the help of all the medicated oils, and these oils are vata pacifying, that is reduction in the vata dosha. As vata dosha is cold in nature, we use hot or hot fermentation or hot oil massage to that to through overall body. We can use bala oil or ashwagandha oil. These are the names which are medicated oils we are going to use during the oleation of the body. Then after we are supposed to sit the patient in the steam bath. That the because of steam, all the pores of the body get opened, and detoxification can be possible with the skin also. So this is also the purpose to do the oleation and steaming. Then we are going to give the patient basti. That basti, that is enema. It is also of various types, but for if we are doing it is the basti treatment as for 8 days, that it is called as yoga basti in Ayurveda. It is of two types, that is oil basti and decoction basti. Oil enema and decoction enema. First day we do oil enema with the bala oil, ashwagandha oil, sahacharadi oil. All these oils are made up of all the herbal things, all the herbs, and these are vata pacifying herbs. Then on next day we do decoction enema. Decoction enema will clear or will clear your gut, as the toxins are get accumulated in gut also. We have to do the clearance of gut also. So decoction enema will do detoxification of your gut. As each and every uh, is Ayurveda believes that each and every disease get formed with the gut. As ama, or the microbiomes, that are the free radicals which are moving all over the body and causing all these pain and disease condition, they get accumulated with the external oleation in the stomach and in the gut. And then after, with the decoction enema, we remove the all these toxins from the body. As the treatment gives you the more benefits with internal as well as external uh, uh, sources. That then basti again comes as like Rajayapan basti. It is used for the chronic osteoarthritis, especially when knees are involved in the osteoarthritis. Knee joints are there. We use Rajayapan basti, and again then we give the palliative or internal medications or internal medicines. For that we use Rasana, Eranda, Dashamula. These are anti-inflammatory drugs which give the relief from inflammation, pain and swelling. Then Boswellia, that is Shallaki or the Gugulu, Comifera mucul, will reduce the joint pain and swelling. Then, like ashwagandha, guduchi, these are the rejuvenative drugs, anti-inflammatory drugs we are giving to our patients. Then Triphala, everyone knows the Triphala. That Triphala detoxifies and reduces the ama. And for oils, we for abhyanga or the oleation, as like if the knee joints are involved, the local treatment we are going to we are introducing them that as like Janu Basti or Janu, it means knee joints. It is get covered with the some part of floor, that is black gram floor, and it is get covered with that portion where it is inflammatory changes are there. And then we give the hot oil bath or hot oil pouring there in that particular area over the knee or over the joint which is get inflamed or which is involved in that disease. That is called local procedures as like Kativasti, Januvasti, where the uh, disease is there, where the pathology or where the pain is there. We are using that treatment, that is local oleation therapy. As everyone knows that stress is today's very much stress factor is very much important in each and every disease. We can use Shirodhara, that is pouring of rhythmic pouring of oil on head, on forehead. It will also relieve the stress. That is also the Panchakarma treatment we give to the patient to release the stress. Not only for joint disorders, for each and every disease, we offer Shirodhara to relieve the stress. Then again, we can give them Nasya, that is uh, we used to drop the oil drops, medicated oil drops to both the nostrils. This will also relieve the stress, and this will also uh, this will also soothe your mind and body to take the medicines and to get the complete effect of that medicines. So to again to strengthen the cartilage and bones, we can use the rejuvenation therapy as a internal medications. As then we can have a shatavari, guduchi, bala, or if as Julie says, there is a osteoporotic changes in menopausal age, we can introduce a Tikta Kshira Basti for that is all the bitter elements which are get prepared in the milk. The decoction with the milk, that is called Tikta Kshira, and we used to give this basti or this enema to the osteoporotic or osteopenic changes through the menopausal aged women. Then also we can introduce them changes of their lifestyles, changes of their diet. Everyone before me have introduced that what lifestyle they have to change. They have to move their joints because the movement, as movement stops, that locking of that joint occurs. So movement of your joints or walking or exercising the joints, it again important as lifestyle management. Then you can avoid cold, dry, stale food. Then excess of pulses, as it increase the vata dosha. Excess of pulses or curd or fried food you can avoid. So not only panchakarma, but with that panchakarma, we suggest them what you have to follow and what you have to avoid, or what are the contradictory food and your lifestyle changes you have to do. So all these things we hand in hand will recover the patient as the patient is recovering with the help of Panchakarma medications, diet, lifestyle management. So we'll do the Panchakarma treatment for each and every disease. But as regarding today's topic, osteoarthritic changes, we are doing these types of Panchakarma treatments.
Dr.
So
Yashashri,
yes,
hello.
sir.
So it's been
Yes,
a
sir.
wonderful session, and I want to ask you a few questions we got from the viewers.
Yes, sir.
So
Yes,
this
sir.
is in perspective of treatment in Ayurveda. So somebody's
Yes.
asked me from an Ayurvedic perspective, what causes joint pain and arthritis, and how does it relate to our doshas?
Yes. For as like in Ayurvedic perspective, we have a Vata, Pitta, Kapha, three doshas, Sapta Dhatus. When there is a deformity formed, or Khavaigunya, we can say as like in Ayurveda, that is there is a wear and tear of that extra use for that joint. The formation of the vacancy or the space where the Vat get accumulated, and that Vata will cause the pain. As the Ayurveda said us that everything in our body is going to happen with the vata. But when vata get vitiated, it will cause the most painful conditions. So according to Ayurveda, when there is a formation of vacant space there, the vata get accumulated and pain will suffering patient will suffer from pain.
Wonderful. I have another two questions. Then I can see our next presenter, Rotarian Lal Goel, is also online. We'll bring him on shortly. The next person asked, how can daily habits such as oil massage or exercise help in managing arthritis and improving mobility?
Yes, definitely. Daily massage, because in Ayurveda context, they have explained the Sadavritta, that is the lifestyle which we have to follow daily. They explained in that Abhyanga, that is oleation through our body, oil massage to our body each and every day, which will pacify the vata, which is get vitiated during our day-to-day activities. As we are doing lifestyle as sedentary lifestyle is there, as we are mostly using the sitting areas and these mm, very small things these are, but we have to take in consideration because each and every home is now made up of tiles. That also will cause the water vitiation. So we have to oleate, or we have to do oil massage to body, to our, not only for joints. We can use the shiro vasti, as like we can use that cotton poured with the oil, and we can keep it on our head. It will also pacify the vata dosha. And before that, when in Ayurveda, they explain through childhood, we have to do all these things. So in India, the after delivery, the baby as well as the mother, they both are get oleated or get oil massage, and pouring of oils in our nostrils, as like our ear pinnas. That is also the pacifying procedures for vata.
Wonderful. And
So
I have one final question. I'm born in Kenya, where it is tropical country. We don't have much of seasonal variation. But now I'm living in the UK. And so the next viewer has asked is somebody, I suppose, from the Western countries, because they are asking, um, does the season affect joint health according to Ayurveda? And should care routines change throughout the year?
yes, definitely. In not only in Western countries, in Eastern or India also, there are seasonal changes. And according to the season, our body gets accumulation of vata, pitta, kapha. But by our lifestyle modifications, we can pacify, or we can make them in their regular manner to work, as our lifestyle and diet will help with us. And again, coming with that point, for the not only for the tropical regions, for every body, there is a seasonal panchakarma explained in the Ayurveda context. Seasonally, as there is a rainy season, we have to do with vasti. Though we are not suffering with the disease, though we are healthy, we have to do seasonal panchakarma. For in as kapha get accumulated, and it get vitiated in the mid of the April and May, we have advice. We give advice to patient to have the vamana. That is, they have get emesis treatment. So seasonal panchakarma is very good, and it is very useful for each and everybody, though it is healthy or though they are diseased, but uh, on advice of medical practitioners, Ayurveda practitioners.
Wonderful. Thank you so very much, Dr. Yashashri.
Thank
You've shared some very interesting perspectives from the point of Ayurveda, and I'm sure a lot of the viewers will find some interesting nuggets from what you have shared with us today. Please do stay back. I'm going to now introduce our next speaker, who is Rotarian Lal Goelji. Rotarian Lal Goelji, welcome to the session today. You should be able to unmute yourself now. Bear with me. Please try to unmute yourself.
Yes, please. Thank
Here
you very
we
much.
go.
Thank you very much, Nishit ji, for inviting me as usual every week and with my guests. And today I'm missing Mr. Neil Kumar on the program, but I'm very surprised to see you today. I remember when we met in London. So
Yes.
thank you very much.
Yes.
Mr.
So
Nishit.
please go ahead, introduce your guest. I will have his presentation
Yes.
ready.
Before I will introduce the guest, because as you all know that I am from Rotary Club of Organ Donation International, and our club is dedicated a cause-based club for organs and tissue donation. And we are talking about the bone-related things. So the bone donation, because bone is a tissue. So I would like to say a few things about the bone donation. After brain death, because we are talking about the bone donation for those who have come out with the bone donation. So after brain death, bone donation represents one of the most impactful yet under-recognized forms of tissue donation. When brain death occurs, donated bone tissue can transform the lives of countless recipients suffering from bone-related diseases, trauma, and congenital conditions. Unlike organ transplantation, bone donation can benefit multiple recipients from a single donor. Bone-related diseases affect millions. Traditional treatment options are often limited, expensive, and may require multiple surgeries. Bone allografts from deceased donors provide a readily available biocompatible solution that can restore function and mobility to patients who might otherwise face amputation or permanent disability. Donated bone tissue serves various medical purposes. Structural allografts replace large bone segments lost to cancer or trauma. The bones provide structural support for spinal fusion surgeries, promote healing in fracture repair and joint reconstruction, and stimulate new bone growth in orthopedic procedures. Bone donation after brain death represents a powerful opportunity to transform tragedy into hope. By raising awareness about this life-saving gift, we can help more families make informed decisions during difficult times and ensure that patients with bone-related diseases have access to the treatment they desperately need. Every donation matters, and every donor becomes a hero to the many lives they touch. So thank you very much for listening about the bone donation from my side. Now I would like to introduce my first guest. Is a very esteemed guest. Ladies and gentlemen, it is my pleasure to introduce Dr. Dayanand, a distinguished orthopedic surgeon who serves as the head of the department and professor at Sri Madhusudan Sai Institute of Medical Science and Research. Dr. Dayanand holds an MBBS degree, a Master of Surgery in Orthopedics, and a Diploma in Orthopedics. What makes his journey particularly inspiring is that he completed his MS in orthopedics at the remarkably young age of 26, demonstrating exceptional dedication to his field. Coming from a family of doctors, Dr. Dayanand's passion for orthopedics began early in life. He has enhanced his expertise through advanced training at leading institutes, both in India and internationally, including earning a FIFA accredited diploma in football sports medicine. His surgical excellence is truly remarkable. Dr. Dayanand has successfully performed over 1,000 complex deformity corrections. This impressive achievements reflects his expertise across multiple specialties, including joint replacement, arthroscopy, trauma management, and pediatric orthopedics. Perhaps the most telling testament to his skill is the trust placed in him by his medical colleagues, who frequently choose him to operate on their own family members. This speaks volumes about his surgical precision and unwavering commitment to patient care. Dr. Dayanand's contribution to medicine have been recognized with prestigious awards, including the Prakriti Award for his exceptional work in pediatric deformity corrections. Beyond his clinical practice, he remains actively involved in medical education, contributing case studies, presenting at national and international conferences, and serving as faculty for specialized workshops in Lejaro techniques and joint replacement procedures. His areas of specialization encompasses the full spectrum of orthopedic care, from sports medicine and trauma management to joint replacement, arthroscopy, deformity corrections, limb length surgery, and pediatric orthopedics. Please join me in welcoming Dr. Dayanand.
Dr. Dayanand, as you come
Yeah.
along, is it possible to flip your phone on the side so we can see you in landscape?
Make it like this.
Just flip it on the side.
Is it okay now, sir?
No,
Yeah.
okay. Yes, perfect. I do have your presentation, so give me an idea when you want me to run it, and also give me some time at the end to ask you a few questions.
Yeah, so you can start with the question, sir.
No, first, why not the presentation, please? Is it?
Yeah,
Okay, doctor?
Yep, presentation
yeah.
first.
Yes, sir, fine, perfect. Thank you for a wonderful introduction, Lal Goyalji. Just move the slide, sir. Second slide. Yeah, second is there. Yeah. So, good evening to all the viewers. Thanks to Lal Goyalji for a wonderful introduction. I'm basically talking on arthritis. See, there are a lot of arthritis. Commonly, one is osteoarthritis, which is usually a degenerative arthritis. It happens because of the old age. Now, the longevity of the human being has been increased. So, once the longevity has been increased, we are bound to have long life. Then our articular cartilage goes for wear and tear after certain years of age. Like any other part of the body, as we live longer, there are wear and tear in the body. So like that, the arthritis is also one which develops because of the old age. So other type of arthritis are secondary arthritis. Secondary arthritis are one who are which are like rheumatoid arthritis, gouty arthritis, and arthritis because of ankylosing arthritis, or because of the trauma and because of the accident trauma where the joint cartilage has been injured and they develop arthritis. So what are the basic symptoms of arthritis? Arthritis starts with a pain initially, then it goes from stiffness, then swelling. So what are the signs of arthritis? Signs of arthritis is mainly they get excruciating pain in the joints, more in the morning hours, and they have a swelling of the joint and restriction of mobility. Next slide, please. Next slide, sir. So second type of arthritis is because of the metabolic disorders. Okay, like gouty arthritis you come across, and autoimmune disease like rheumatoid arthritis. There is no exact cause, so body will produce own antigen antibody reaction which affects on our joints. There are similar arthritis. Same slide, previous slide, sir. Similar arthritis like psoriatic arthritis, there is all of you know that there is a disease called as psoriasis for the skin, which can also lead to joint arthritis. And reactive arthritis is another form where you have like chronic bowel disorders or inflammation or infection in some other part of the body, which gives rise to reactive arthritis in the joint. So crystal arthritis is one which is because of the gout, because of our body has got what is called as uric acid. When our metabolism of purine disengages, it leads to increased uric acid and gives rise to crystal arthritis. Next slide, sir. So what are you going to see in basic arthritis? So when we examine the patient, we see, first of all, whether the joints have been aligned properly or not. If, as you keep on in the initial stage of arthritis, joints are straight. When it gets advanced, they start developing deformity in the joints. So we have to assess the bone mineral density of the patients. See, many patients to come and tomorrow, sir, I want to get a joint replacement done. So once we can't just go with the joint replacement when the bones are very weak. Even if you undergo replacement, after the replacement in few weeks or months, they'll break the bone above the what artificial joint we have put or below the joint. So it is very important to assess the bone mineralization and correct it before going for the joint replacement surgeries. So what we assess basically when the patient comes to with arthritis, we normally examine them and take a basic X-ray. When you do X-ray, that is radiograph, we assess the cartilage space, whether there is a cartilage is still left or cartilage is fully destroyed. And so that we can understand when the cartilage is, whether inner portion of the joint is destroyed, outer portion of the joint destroyed, and we can assess the weight bearing distribution of that particular joint. So once we assess the weight bearing alignment of these joints, so we can modify the braces and help the patient to go with medication and brace treatment without going for a surgery. And another very important in arthritis is soft tissue balancing. So whether how is the soft tissue? Soft tissues are strong or not. So if the patient is soft tissue, like in knee joint, the quadriceps, in hip joints, it is abductors, muscles. In shoulder, it is rotator cuff and deltoid. We have to assess the soft tissue. Many times, simple soft tissue strengthening and bracing is sufficient to treat the arthritis. Next slide, sir. So, next. So these are all the joint spaces one has to assess before going for the planning for the surgery. Next slide. So what is the commonest arthritis in the society we come across? We come across is osteoarthritis. Osteoarthritis is because of the cartilage keeps on disintegration of the cartilage happens as we keep aging. So joint will go for wear and tear and they start developing osteoarthritis. Next slide. Next slide, sir. So many times this osteoarthritis is because of the obesity. So one has to maintain the normal body mass index. If a person with this normal body mass index, if you develop a mild arthritis, which is all reversible, if the person BMI is too high, they have to bring down the BMI to normal. Otherwise, arthritis cannot be eliminated or cannot be reversed. Even the person is on higher weight side, if he can bring down his BMI to normal, by medication and bracing, we can bring down the arthritis under control. Next slide. Next slide, please. So most of the arthritis are developing on the inner aspect of the joints, especially in the knee joint. The outer aspect doesn't get worn out because in India we sit in always in a cross-leg position, and many professions they do in a sitting position like goldsmith and all. They develop wear and tear in the inner aspect of the joints. Our inbuilt is little varus. So varus means which is little bent bowing of the knee joint outside. Westerners, they have a valgus knees. They have a bowing of the knees on the inner aspect. So they don't wear off the knee joints. They wear off usually the hip joints. Next slide, sir. Next slide, please. Can you hear me, sir? Yeah. So how do you manage these medically these weak cartilages? So what we do when the person comes to us for the medication purpose, whenever they have an arthritis, we assess them. What is the BMI? What is the bone mineral density? And we take the X-ray. And after assessing the X-ray, we look at the joint spaces. Can we conserve this joint without surgery? Is our first assessment. Most of the time, we can just go with the arthrosis. Arthrosis for the external supports. For example, if the joint is worn on the inner aspect, we go for a valgus braces. When the joint is worn out on the outer aspect, we'll go for the varus braces. So these are all osteoarthritis braces. So which will load the weight in a proper direction and offload from the painful area, and which will help in the mobility. So, and also we use a lot of medications. Like initially we start with anti-inflammatory medicines, which is reduces the swelling and improves the inflammation and brings down the inflammation, and patient is comfortable. And we have some particular medicines like collagen. Collagen, type 2 collagen is being used in osteoarthritis for all types. And my Ayurvedic friend was just talking before me. So we also use some Ayurvedic drugs. We are not supposed to prescribe. We ask our Ayurvedic colleagues to give prescription of Boswellia and turmeric. Turmeric 99 and Boswellia really helps in cartilage regeneration. Keep going, sir. Next slide. So as picture shows that the inner aspect, the joint is worn out. In this patient, arthrosis brace will help because outer space is still maintained. Next slide. Next slide, sir. So when we go for surgery in the joint, when the joint cartilage is fully worn out, so when we feel that no more cartilage is there, then we go for a total joint replacement. So how common is the hip arthritis globally? In Southeast Asian countries, the knee joint osteoarthritis is very common. And in UK and US and Europe, osteoarthritis of the hip is common. Why? Because they don't squat. If you squat and use an like Indian commode, and if you have a habit of sitting in the crossed leg in a short duration, hip automatically remolds and it doesn't go for osteoarthritis. So that is how Southeast Asian countries, we don't get hip arthritis, and we get knee arthritis. Knee arthritis because we squat a lot and we sit cross-legged for a long time. So if you balance between these two, if you do, we can say both hip and knee joints. Next slide. So this is a photo showing an arthritic knee, which is the total hip is disorganized and arthritis has been developed. So what is the treatment for this? If the patient comes in early stages, we can manage with medications, anti-inflammatory medicines, collagen, Boswellia, turmeric 99. These are the medicines. If there is a little bit of joint space is still left, we can go for medications like injectable, like PRP, which helps in reducing the inflammation, improves the cartilage. The most common one we get is a knee arthritis. It is unicompartmental. Unicompartmental, if it is, which can be managed with the braces and medication. Otherwise, what we do is we realign the joints. We do a small cut in the bone and distribute the weight in a proper way so that they can avoid the joint replacements. In case if they have a bit of loose bodies and all, we remove it through arthroscopy. That is a minimally invasive surgery so that arthritis progression can be halted at that stage. Next slide, sir. So stage 1, we always manage with the medications. Stage 2, stage 3, we manage with medication, bracing, and PRP injections, and hyaluronic acid injections, which will delay to go to the stage 4, which is the stage where patient requires joint replacement. Next slide, please. So will the osteoarthritis affect the other joints? So it can affect other part of the joints like small joints of the hand. Rheumatoid also affects the small joints of the hand. Gouty arthritis usually affect the joints of the foot. So whenever the patient comes with pain in the foot, first thing which goes to our mind, patient has got a high uric acid. So is it uric acid is because of only high protein diet and non-vegetarian food? No. Sometimes the body has got an enzyme called as xanthine oxidase. If it is not in sufficient number, which is a hereditary condition, so they, even though they are pure vegan and vegetarian, they still get gouty arthritis. So as a doctor, as a clinician, we have to differentiate whether it is because of the xanthine oxidase inhibition or overloading with body with the proteins. Like if you go and join a gym for lifestyle modification, they start giving a big box of artificial whey protein, and if you take in excess, which is also going to damage the joint by causing gouty arthritis, it also creates the kidney problems by excess protein. And in the society, protein requirement is being grossly over exaggerated. We require only 0.75 gram per kg body weight of protein. Maximum people who are into active physical activity and muscle building activity, they require maximum of 1.5 grams of proteins. Excess of proteins will lead to high uric acid formation and causes arthritis. Will the spine also gets affected in osteoarthritis? Yes, spine has to be moved minimum 10 to 12 times for lubrication. In between the spine, in the vertebra, we have what is called as a disc. So these discs are the cushioning agents. If you don't do exercise, if you don't take the spine in full range of movement, at least 10 to 12 times in a day, it will give rise to no nutrition to disc, and it will start degenerating and start giving osteoarthritis. So the moral is that our spine has to be taken to full range of movements at least 10 to 12 times in a day. Most of the laborers, it happens, but office sitting jobs and which will not happen, so that one has to spend some time to do exercise. If somebody can practice in yoga, Surya Namaskara, which will give head to toe exercise, including the spine, at least minimum of 5 sets of Surya Namaskara, which can prevent osteoarthritis in the spine and other joints also. Next slide, sir. Next slide, please. See, when the patient comes in and engaged, so we evaluate not only with an X-rays, we also do MRI. We have a joint specific MRIs which assess what is the thickness of the cartilage, whether the cartilage is fully worn out, or do they have any other pathology which is leading to osteoarthritis. We can make out from MRI. In a primary setup, we don't require an MRI to diagnose osteoarthritis. MRI is, in fact, if it is done, it shows excess than what the patient is having. It is like a photograph which has to be compared to the person, to our clinical examination. Then only we come to conclusion whether all these things what MRI shows in exaggeration is it patient is having or not. Other day I was telling my friend that the patient came for an MRI of the spine and patient had a gynecological problem was diagnosed. So Patient never had any gynec symptom. Patient went for a gynec MRI and they showed 2 levels of disc. So many patients do send MRI on mobile to give the opinion, and MRI shows as much as 38% of false positive thing. So don't rely on just MRI. And few of the patients, after seeing MRI reports, they were literally worried, did not sleep for 2-3 days. So MRI is not what it gives, shows everything may not be reflected in the body. So clinical examination is must for all these patients. We have to assess pain, swelling, stiffness, deformity, instability, and loss of motion. Then compare with an MRI whether these things are correlated with MRI. Then only we can come to proper conclusion. Next slide, sir. So am I okay with my time or I can't hear you, sir?
Yes, you can carry on.
Yeah, so I'm just showing the picture of the braces. These are all the offloading braces. So these offloading braces really helps in take out the load from medial to lateral. There is a small screw on these braces. We can make it a straight knee by turning them so that the weight is properly distributed whenever the patient comes in grade 2, 3. We can make a customized knee braces and make the patient walk, and patient can avoid knee replacements. I have patients since 2005 also. They are still using almost 21 years. They have thanked me for not submitting for them knee replacements. Couple of them were told 20 years back knee replacement. If would have done that time, they would have come for revision of the knee replacement by this time, because the knee replacement doesn't last for lifetime. Next. So this is whenever there is an early stage when the patient comes, young patient, if they loose body and all, we just put a small scope as shown in the right upper corner. We just remove the loose bodies and we halt the osteoarthritis at that stage. And if the patient doesn't respond with one side arthritis, then we cut the bone, that is called as osteotomy, and make it all right. If the patient is badly uncontrolled diabetic, they get what is called as neuropathic joints, where even if you do arthroplasty, that is joint replacement, they come for revision very early. So in that cases, what we do is called as, we do arthrodesis. The arthrodesis, we fuse the joint and weld the joint, but that we do it in 1 in 1,000 cases. Very rare cases we do it because they can't move the joint. So that is a disadvantage. But whenever there is a patient is totally bedridden and stiff joints, they can't even walk, and they are not fit candidate for arthroplasty, that is joint replacement, when we go for arthrodesis.
Doctor, excuse me, doctor, is it possible now we should take some questions, because
So I conclude here. The last stage for osteoarthritis is a knee replacement. This is an artificial knee which has been put. We have different type of knees. We put oxynium knee in younger patients who come, elderly patients, cobalt, chrome, and titanium, and this is the picture of the. So we are ready to take the questions, sir.
Okay, thank you very much, Dr. Dayanand, for giving us all the details about arthritis. And I know that you can give a long lecture on this, because you are an authority in this and you are teaching the medical students. That is a very, very important aspect. And but as you have mentioned in your presentation, that obesity is one of the main factor for arthritis. But we have seen some cases where there is no obesity. Patient is quite lean and thin, but still they develop the arthritis. Can you just highlight and enlighten?
So there is primary arthritis, that is because of the aging and obesity. Secondary arthritis are one which can happen even in the slim individuals. Okay, like rheumatoid arthritis, it is autoimmune disease. So gouty arthritis, like uric acid is increased and which leads to gouty arthritis, which can happen in young individuals. young and thin individuals. So we have to find out what type of arthritis is before planning for the treatment. Osteoarthritis, see, even this secondary osteoarthritis like gouty arthritis, rheumatoid arthritis, if the patient is obese, reversing the disease is very difficult. So first is any type of arthritis, one has to have lifestyle modification. Like for example, in my family, two of my sisters underwent knee replacement. As a busy surgeon, my weight had gone up to 110 plus. So my wife always used to tell that is your next candidate. I reduced 38 kgs after operating two of my sisters. So then I am not a candidate now for knee replacement. So this is how life goes.
Okay. Thank you very much, Dr. Dayanand. And now I'm opening. But before that, I would like to thank the Healing of Our Earth because they are doing sessions every week on the topics which are very, very important for the community, for the society, for the countries, and for the entire earth. And for that, I must thank Mr. Neil Kumar,
Sir, and
Mr.
sir, all
Nishit.
arthritis in many cosmos, they once the patient go with knee arthritis, irrespective of their age and the degree and stage of diseases, they are recommending for knee replacement. One has to be cautious. I have more than 100 patients who modified their life and escaped from the total joint replacement because after a few years of replacement, they require a revision. Okay, see, if obese patient undergoes joint replacement, if obesity is not reduced, instead of joint coming for about 30-35 years, it will last only for 10 years. So keep it in mind. We have to explain the patient, and all stages doesn't require. My message is that all stages of arthritis doesn't require joint replacement, and patient can still manage grade 1, 2, 3 with the medication and bracing and other modalities without knee replacement.
Okay,
Dr.
thank you very
Dayanand,
much. Thank you very much, Dr. Dayanand. And now we are opening it for the questions from others. Over to you, Mr. Nishit, for asking the
yes,
question. Yeah.
yes, Dr. Dayanand, I wanted to ask you one question that you mentioned genetic factors. How strong is the hereditary component, and what can people do if they are at high risk?
So genetic factor is mainly in seronegative arthritis. These are called as ankylosing spondylitis, rheumatoid arthritis. Okay, and there are a few more conditions uh, like villonodular synovitis. These are all the. This is hardly 1% of the whole spectrums of arthritis.
Okay. And the other question was, I had one aunt who had arthritis, and she could have arthritic pain flare up or fluctuate on a different day kind of basis. What causes these kind of flare ups, and how can patients manage them better?
So these flare ups are usually in rheumatoid arthritis. So rheumatoid arthritis usually in the cold season they get flare up, and in warm they feel comfortable. Okay, so whenever there is a flare ups, and my other friend was talking about massage and other things, oil massage. During these flare ups, they should never massage the joints because the inflammation part will grow. I mean, it will increase 2 to 3 times more, and they start getting more pain. So whenever there is the seasonal changes in rheumatoid arthritis and seronegative arthritis, they should keep themselves warm and they should do muscle strengthening exercise so that the flare-ups are less.
And last question from me is, arthritis is typically known as an old age disease, but younger and younger people are getting it. So the question was, in your experience, are there any early warning signs people should not ignore that can help them to diagnose arthritis sooner?
Yeah, sir. Once they have, if any person has got a arthritis less than 40 degrees, we always think in terms of secondary arthritis because of the gout, because of the rheumatoid arthritis, or it is a post-traumatic arthritis, injury to the cartilage and following arthritis. So these are the ones in younger generation we should rule out and treat them. These are all preventable arthritis. If you don't prevent at young age, then they'll go for early osteoarthritis. Okay, that
Okay, thank you very
Wonderful.
much.
Okay, I'm going to hand back over to Rotarian Lal Goelji.
Okay, thank you very much, Dr. Dyanand. Please stay with us so that whenever we will have some more questions for you, we'll definitely come to you. But now I would like to introduce my second panelist guest, and she's Dr. Supriya Khandelwal. Dr. Supriya Khandelwal is PT, BPT, BSc, MPT. Dr. Supriya Khandelwal is a pre- and orthopedics rehabilitation specialist with over 17 years of experience in the field of physiotherapy. She currently serves as the head of the Department of Physiotherapy at Mass Saraswati Hospital in Mathura. Dr. Khandelwal completed her bachelor's degree in physiotherapy from the Institute of Physical Health and Hygiene, IPEH and earned her master's in physiotherapy from Sanskriti University, Uttar Pradesh. Throughout her distinguished career, she has worked at several prestigious medical institutions, including RBTB Hospital at Kingsway Camp in Delhi, Sanjay Gandhi Hospital in Delhi, the Physiotherapy and Health Center in Delhi, and Nayati Super Specialty Hospital in Mathura. With her extensive experience and specialized training in orthopedic rehabilitation, Dr. Khandelwal brings valuable expertise to both pre-operative preparation and post-operative recovery for patients with orthopedic conditions. Please join me in welcoming Dr. Supriya Khandelwal. Dr. Supriya Khandelwal, you have heard our previous speaker, Dr. Dyanand, and he has explained in detail about arthritis. Now, Dr. Supriya Khandelwal, you are doing the physiotherapy pre and post operative, and sometimes even for the prevention of the arthritis to grow. We would like to know your views on arthritis and joint pains. Dr. Supriya Khandelwal, please.
Good evening to everyone. Sir, Dr. Dayanand sir already explained a lot of things about arthritis, how the arthritis happen, what are the causes, what are the treatments, how it progressive, there are the progression levels also, but we get the patient at every progression level, like stage 1, stage 2, stage 3. So we treat patients according to the stages of the osteoarthritis. I made a small presentation for this, so I really wanted to share this thing with you.
Yes, please share.
I'm sharing my screen.
Yeah.
Yeah, Dr. Supriya, can you start the presentation?
Yes,
We can
yes,
see. Yes, please.
Yes. Sir already explained that what is arthritis. So arthritis is an umbrella of 100 kind of inflammatory problems. There is like so many reasons behind it. Sometimes ACL, PCL, osteoarthritis happens just because of the ACL, PCL injury. Patient don't realize it. Some patient who are not aware of their injury, sometimes repetitively pain that causes osteoarthritis to the knee. There is a rheumatoid arthritis also. We have seen that lot of after the pregnancy, lot of women get RA factor positive. Because of that, they get rheumatoid arthritis. Even after 5 years of their pregnancy, they go for a RA test. Still, the test is not positive, but they have similar kind of pain. What you see in a osteoarthritis, like small joint pain, continuously pain on the knee. There is every time when there is a seasons genes, they feel the pain. So the repetitive at the young age, they get the wear and tear and inflammatory problems. Because of that, they feel the pain. And like there are so many other reasons also. Sometimes there are poliotic patients who don't put their alignment. They don't, their body is not aligned because of the continuous pressure on the joints. They get arthritis. And see, I want to share one reel with you all people, which shows that how knee joint looks like when it gets arthritic. This is how the rubbing of cartilage, the inflammatory conditions look like after normal joint to the inflammatory problem. Now I want to share with the shoulder joint. This is how the inflammation happens in the shoulder joint and how it looks like. There is a lot of redness, inflammations. Because of that, patient continuously feels pain in the shoulder joint, and sometimes it radiates to the arms also. And this continuous process lead to the arthritis of the shoulder. Next. Took the time continuously. See, sometimes tendonitis also leads to the arthritis to the shoulder joint. Repetitively, like the stiff shoulder leads to the tendonitis, and that leads to the arthritis of the shoulder joint. And that leads to the frozen shoulder, and patient has lot of pain and inflammatory joint. Now another joint which get affected is neck, cervical joint, cervical disc, the spine of the RS cervical, which leads to the lot of pain in the neck, and the disc bulges and continuous pressure on the trapezius muscle get tightened, the shoulder neck muscles get tightened. Because of it, that leads to the arthritis to the neck, and patient continuously feels neuralgia and everything. This is how it looks like. So this is how the neck pain occurs. I'm all sharing the degenerative and inflammatory processes, wear and tear in the neck joints. Now this is the second, how the lumbar joints get affected. Problem. So you can see that how the disc plays the role in the degeneration of the spine. Continuous sitting, the sedentary lifestyle of nowadays make the disc to get degenerate very easily. People are sitting, standing, they are spending their lot of hours in standing and sitting. This leads to the disc bulging or slip disc. That leads to the arthritis of the lumbar spine, and that causes lot of pain and inflammatory diseases. Now, sir has already explained there are so many types of arthritis. Even I was also discussing the inflammatory arthritis. There is infectious arthritis also. There is pot spine, which is commonly found at the age of 50. Lot of people get this pot spine, which leads to the degenerative spines and gives lot of pain, inflammation to the joint. Sometimes that gives stress to the patient also, because the pain in the pot spine is so severe that they that affects their lifetime, their lifestyle. Metabolic arthritis is also there, that it's gout, that uric acid increases. Nowadays, most of the people, because of our eating habit, we are eating outside. We have having lot of outside foods. Because of that, gout arthritis is very commonly found. Most of the people having these problems, uric acid increase. Causes of arthritis is also very already sir discussed. There are a lot of causes because of this joint. There are uric acid, there are infection, there is post-traumatic arthritis also very common. Like people get the this thing, internailing and nailing procedures done, orthopedic surgeries done, and after that they don't do exercises, they don't take care. Because of that also they get the arthritis, because of the disalignment of the joint, disalignment of the other joint which is not affected, and the affected joint get affected. Because of it, they they that affected joint leads to the unaffected joint to the arthritic situation. There are a lot of medication and supplements has been given, like vitamin D is also plays very important role in the arthritis. People having very less vitamin D and calcium, that leads to the arthritis. So proper supplement, taking a NASDAQ is not a, when you are in a severe inflammatory condition, only NASDAQ is the something which can help you out and which can give you a relief. Vitamin D, vitamin B12. So proper supplement, proper take care, proper protein should be taken while you are having arthritic conditions, early arthritic stage, to lead. Exercise, very important role played by the exercise to the arthritic joints. Like sometimes people come with the early stages, like at the age of 40, they feel that below knee they are feeling at the medial compartment, they are feeling the pain. That pain they feel because of long-term standing, sitting, cross sitting. Because of that they feel the medial compartment pain, and that is the starting stage of osteoarthritis, where they need to take care, where they need to see why this pain is happening, why this problem is coming again and again. When you go for a checkup, most of the time this found that vitamin D is less, sometimes B12, there is continuous rubbing of cartilage. Because of that they have continuous pain, or maybe they are standing for long hours, or they are climbing, and stair climbing also plays very important role. Lot of patients climbing lot of stairs, like 100 to 200, like 50-40 times they are climbing the stairs. Because of that they get the early cartilage compression. Because of that lead to the arthritis at the early stages. So they need to take care. Like in the rheumatoid arthritis, we feel the pain in the small joint. That is a sign which shows very early in the rheumatoid arthritis. If you have a pain in a small joints, if you have a early morning stiffness, so you need to take care. You need to see why this is happening, and you go for a doctor, go to checkup, and they will see what exactly is happening. And the knee strengthening also plays very important in quadricep muscle. We need to take care, need to take care of quadricep muscle, because that is the only muscle which will helpful for the knee strengthening. And the more your quadricep is healthy, the more your knee joint will be healthy, and that will give you a better lifestyle. The leg exercises, proper protein intake, proper exercises. Like the most common problem which I see in a people is that they come us and they complain that we get the joint stiffness. Most of the time when I'm going for a longer walk, I feel, when I sit, I feel the stiffness. This is because of the omega-6 less. They have the deficiency of omega-6, and that joint is going towards the quadricep weakness. So we need to take care our quadricep muscle during this symptom, that you feel the stiffness in the joint. You need to see, is my quadricep muscle is working properly or it's not. So we need to take care of our quadricep muscle, so that it will be It will not lead to osteoarthritis. Even in the back pain also same problems come. People are continuously sitting. They are sitting for long hours, like in the sitting in the this jobs, they are sitting for long hours. Because of that, this leads to the back pain. And sometimes in the household activities, the housewives are working so hard, they continuously bending, they are sitting on the floor. Because of that also they get a back pain. And shoulder, like you don't know when you are sometime when you are working, you just use your shoulders so harshly that it leads to the injury to the joint, and it gives you lot of pain, and that continuous pain leads to the arthritis of the shoulder. So we need to take care, we need to exercise ourselves, we need to take care. Our rotator cuff is also very common problem, that if there is a rotator cuff injury, that lead to the in the early stages, that lead to the arthritis. So we need to see what exactly is going through our joint, and we need to take care, we need to exercise, we can go to therapist, we can use lot of modalities. Even in the season change also, that also discuss Dr. Dayanand also, that the seasonal change also plays very important role in the arthritis. So at that time we need to take care, we need to take a proper rest, we need to mobilize our joints. Because even when we are in a pain, we don't mobilize our joint, we don't do activities. But sometimes less activities also leads to the stiffness, and that leads to that increases the arthritis, and that increases the pain in the joint. So we need to take care of these things. We need to do a simple basic exercises, basic strengthening exercise. This is what I was discussing. Do lot of yoga. Breathing exercise plays very important role. That gives hydration to your muscles, so that the inflammatory part reduces, and gives you medication. There are some do's and don'ts which we should need to do. The first thing, that weight control. Weight control plays very important role. The less pressure on your joint, uh, the less weight on your body, the less pressure is on the joint, and the less pain will be there, and less arthritis will happen with your joint. Yoga, breathing exercise, commode training. Like in India, most of the people sit on the Indian toilets, that leads to the arthritis to the knee joint. So they need to use the commode. That I earlier topic I was discussing, that too much stair climbing also lead to the arthritis. Use lift, like this is what I was discussing. When we don't mobilize our joint, sometime when we don't use our joint, we need to mobilize ourselves. For mobilization, we need to do simple things, like simple walk, do a lifting thing. Cold and hot formation also plays very important role. Like during the seasonal change, we get a swollen joints. At that time, we should use a cold packs, so that reduces the inflammation to the joint. Hot packs also plays important role when there is chronic pain. We need to use a hot packs. There are other modalities also that lead to the tissue healing, and that leads to the pain relief. And supplements, vitamin D, B12, exercise, new joint, and very important that the Ayurveda doctor also discussed that eating turmeric, ginger, and garlic, that reduces the inflammation, and that leads a smooth life for you. So it is very important to take these things from our kitchen. The natural remedies we can use, for example, this is what I discussed: turmeric, ginger, omega-3, Bashwava, anti-inflammatory products, exercise, gentle exercise like yoga, dietary changes like eat lot of vegetables and fruits, so that there will be less pressure on the joint and you will reduce weight easily. Diet and nutrition also plays very important role. in arthritis and joint pain relief using berries that decreases your degeneration. So eating a berries is a very important thing after 40. A sugary drink should not be taken. The saturated fats that exaggerate the inflammation. Staying hydrated. Hydration is very important for the muscle. The more hydrated your muscle, the more strength it will have, and the more power it will give to your joint, and your joint compression, your muscles will be recovered easily. Stress also plays very important role nowadays. Everybody is so stressed. A lot of stress is there around us. So we need to calm down ourselves. We need to take care. We need to think why this stress is coming, and the continuous joint pain also leads to the stress. When you are continuously from last 5-6 years because of the arthritis or because of the any of the inflammatory condition, you get the stress. So we need to take care this stress also for our joint pain relief. Proper sleep is also very important. Sleeping also plays important role. When you get a proper sleep, when you take a 8-hour sleep, that really gives you a relaxation. Your joint get rest. Domes won't happen. Sometimes people doing a lot of exercise, they are going gymming, doing extra exercises, taking protein also. Still, they are not getting the relief. They get the pain. So for that, you need to rest yourself. You need to uh, really need to take care of your joint, and you really need to take care your muscle so that it get into a full recovery phase, and after that you can do exercises. For sleep is also acupuncture, massage also very plays important role. There are simple MRP techniques which releases your the taut in the muscle, so that you'll get the relaxation. Yoga, herbal remedies, I already told. So these are the things which I discussed. And if there's somebody is having any question, they can ask me.
Okay. Thank you very much, Dr. Supriya, for giving your presentation. And I'm sure today the viewers who watched the program, who are watching this program continuously, and especially the Indian segment from 9 p.m. where one orthopedic surgeon doctor as well as a physiotherapist both have given their views. Now I would like to open the questions, but before that, my simple question to you is brisk walking every day in the morning for about an hour can also create arthritis, as you mentioned that when there is a friction among the bones, then the arthritis develops. So
Yes.
as I walk every day for 1 hour, brisk walking in the
Yes,
morning.
if somebody is having RA and that get aggravates, so that at that time you need to relax yourself. If you are going to the gym and some injury happened, you pulled a weight like you pulled lot of weight, so for that you need to take a rest. If still you are working, still you are walking, that leads to the pain. So we really need to take care our pain first. If there is pain doing any of the activity, first we need to think why this pain is happening, and for that we need to take a exercise. We need to see why it is happening. If it's happening, we should stop that thing.
Okay, so
Mobility, I told now,
listen to
mobility
your.
and pain both are correlated.
Thank you very much. So listen to your body and do accordingly.
Listen to
Thank
your
you very
body,
much.
according to your body.
Yes. Thank you very much. Over to you, Dr. Amrita Sharma, for the question answers.
Thank you, Rotarian Lalji. I think that Meeta has a question. Meeta ji, you want to ask something? Yes, kindly unmute yourself.
Global namaste, everyone, and very interesting topic. I've been watching, since the beginning. Very intriguing part is squatting. squatting was, I was just going on Google to find out, and AI says yes, squatting helps arthritis. So squatting, especially when in traditional way, when you use the Indian toilets, it's squatting position. And my brother who lives in USA, he squats every morning to drink water, certain amount of water to start the day. So does my mom. But I was wondering, what is the benefit and what are the losses of squatting?
The benefit of the squatting is that when you squat your body, you are opening your knee, you are providing energy, you are increasing the blood flow to the joint. But if you having a osteoarthritic condition, if you have a arthritis, then that gives more wear and tear to the joint, and that osteophytic formation lead to the pain. So we have to really see what is the anatomy of our joint. If our joint are normal, we can sit in the squat even at the 80 also, at the age of 70 also. But if you have a osteoarthritic formation at the knee joint, then you cannot squat. You really need to first strengthen your muscle, then you can squat. First you need to see if the pain is there, you cannot squat. It lead to the wear and tear to the joint and gives more damage to the joint.
Okay, thank you. I
Thank
would
you.
like to ask the same question to Dr. Dhyanand, what he says
Yes.
about squatting.
Yes,
Please
please.
unmute. Please, Doctor, unmute. Please unmute Dr. Dhyanand. Yes.
Sir, squatting is good to prevent of arthritis. Okay, if somebody is already developed an arthritis, few people will develop pain in particular position of squatting. So once they have already developed arthritis, they have to strengthen the muscles. Once they bring the pain part under control, then they again start squatting. See, and you were telling about the walking will it cause wear and tear. As long as our BMI is normal, up to 10 to 20% body will, our cartilage will be resilient. If somebody has got a more than 30 to 40% excess BMI or a weight, and those they start wearing off their joint. Okay, the squatting is good for all the people in reduction of the prevention of arthritis.
So why, Dr. Dhyanand, the people are against the Indian toilets?
No, sir. Indian toilets prevents hip arthritis 100% because remodeling, sitting in a cross-leg position prevents hip arthritis and throws bit of strain on the medial joint space if arthritis is already developed. If arthritis is not developed, squatting is excellent. And that
Yes, doctor.
see there. For example, inner part of the knee is worn out, then only we tell them don't squat and don't sit cross-leg. If outer side is worn, it is compatible with their squatting and other activities.
Yes, Dr. Anukul. Yes,
Thank
please.
you. Thank you. There was a very interesting study done, I think around 2002 or 2003 in Japan, about equitable distribution of weight, particularly in the hip osteoarthritis. It was noted that between the Western world and the Eastern, where we use squatting system while we go to the toilet or whatever it is, the hip joint undergoes a much bigger, wider movement, and there's a distribution of weight in different other parts of the hip, which normally in the Western world, in the sitting commode, you do not have. So that equitable distribution is certainly one of the causes of reduction in the osteoarthritic percentage of patients within India. And number two is also in the squatting position, even in the normal life, for urination or other kind of thing. That also is meant to be helpful for the knee joint because they're actually using all just one or two groups of muscles. So that is one of the other factors. As far as walking in hard surfaces concerned or running things are concerned, I think what we have to recognize is the fact that pain is a major advisor as to what should be done and what should not be done. Because I used to be working with, I was Dr. Sarmiento's fellow, and used to consider how the weight is distributed in the various parts of Dr. Sarmiento, the functional cast bracing person. So he passed away the year before last. But we used to find out the pressure and how it is distributed in various parts of the bone. And based on that, we have, of course, come across with various what they call varus and valgus type of braces. But in reality, we just have to listen to what your body says in terms of pain if it has already appeared. And that's exactly Dr. Dayanand was saying.
Right.
Yes.
Right. So, Dr. Dayanand, I also wanted to ask you a question about, do you think there is a gender differentiation in terms of arthritis? Like, do women have more arthritis because of their hormonal changes, or it is more based on occupation, or what are the reasons? And second thing, I also wanted to I want you to throw some light on the menopause and arthritis. So, a lot of women at old age have this kind of an issue. Over to you.
See, what happens once they reach menopause, within three years of menopause, they lose 30% of bone mass. So once bone mass is gone, most of the time, especially in women, losing the bone mass leads to the collapse of the joint and arthritis at later stage. So if you can maintain these first 3 years of postmenopause, okay, maintain your vitamin D, calcium levels, and expose to sunlight, and do some activities which involves your muscle strength. Okay, so then one can prevent. Most of the gynecologists themselves, they take treatment for postmenopausal. They either switch to alendronate or they go for hormonal therapy. Okay, but for a patient, I don't see they advise. Many of the gynecologists have asked why you don't do that. Okay, they say, yeah, somehow we are lacking in that. Simple one, alendronate tablet once a week for 3 years, it really will prevent in losing the 30% of the bone mass. Even for, there is not much difference in male and female ratio of osteoarthritis. If they take this postmenopausal care, they will be equal to men and women. Otherwise, the woman will end up in more of osteoarthritis and hormonal change. In fact, woman has got more of almost all the hormones are joint laxative. Okay, they have more flexibility. If they can maintain bit of bone muscle strength, they can prevent osteoarthritis.
Dr. Supriya, would you like to enlighten us that by doing some physiotherapy, the women post menopause can get that things what Dr. Dayanand is saying, that to maintain 3 years, whether your physiotherapy will be.
Yes, sir, because we do a lot of strengthening exercise, that is like the exercise which is helpful in their pain relief also. Like the woman comes in a hormonal disabilities, hormonal stage where she is feeling a lot of pain. So we do a lot of exercises which are planned according to her joint condition. According to the core muscle training we do, like if she needs quadricep exercise, we do according to her pain. If she's feeling the pain in particular movement, we'll alter the movement and we'll do the same muscle strengthening with a different kind of exercises. So physiotherapy is very helpful. Even if they'll go to gym or to do yoga, they do a lot of excessive movement which are not required. Maybe they are not able to do it. So if they come to physiotherapist, we do the proper planning exercise, proper core exercises for the particular person.
Yeah, that's wonderful. We have Dr. Anjali as well, who is a physiotherapist and who has joined us. And we have a regular guest contributor, Riddhi, who is a yoga expert. Let's take a quick comments from Dr. Anjali before we move further. Dr. Anjali, global namaste and a very warm welcome to you. Kindly unmute yourself and share your views of what Dr. Supriya has said.
Please unmute.
Okay.
No, you are again on mute. You are on mute, Dr. Anjali.
Yes, please, Dr. Anjali.
Yeah, thank you, Dr. Amrita. Thank you, Dr. Goel, and everybody. Global namaste to everybody. And thanks, Dr. Supriya. It was a very wonderful session. I think arthritis and pain and women and pain is something which we see nowadays growing more because more sedentary lifestyle. And what's my question to you is, Dr. Supriya, what would you recommend to young women? You know, they want to go to the gym and they want to exercise a lot. What is your
Yes.
recommendation for young women? How do they take care of their joints and not have injuries while they're doing gymming?
Because when they are doing gymming, uh, they have recurrent injuries and they are avoiding it just because they wanted to go again and they don't want to do the exercises. So whosoever female comes to me, she's in a young age, she don't have any arthritis, but she having continuous pain. So there must be two reasons. One is inflammation. There must be some inflammation in her body. Because of that, she's feeling the pain. First thing, and second thing, she must be not resting properly. She's not giving a proper relaxation to her joints, mind, and body. So this is what I suggest to all my female friends or women or patients who comes to me for this.
Thanks, Dr.
Thank
Supriya.
you.
I have one more question to Dr. Dayanand. I was looking at all your presentation on the varus deformity and the valgus deformities. We generally see a lot of patients nowadays having a lot of knock knees, or maybe because of the weight distribution on the middle side of the foot. What recommendation do you have for the younger population, doctor, so that we can avoid old age arthritis for them? Though they're not obese, but they have developed this knee varus because of the way they walk. What do you recommend for them? Just a brace would help them, or some form
No,
of
if it is an
osteotomy?
in younger patients, when they have virus, probably they must have developed a childhood vitamin D deficiency and later they have a persistent virus. Second possibility is obesity, which is going for an early arthritis and varus knee. Okay. So even adults also, we have a lot of people because very small percentage of the people get exposed to sunlight, what is required for us. Okay, get ultraviolet rays and whatever the food we have taken, which will go for a proper metabolism, we require sunlight. Since 95% of the population is not doing this unless they are manual laborers working outside in the field, they only do it. Even as an orthopedic surgeon, if I don't play tennis in the morning, okay. Out of 80 doctors, we checked only mine was vitamin D was normal without supplements because I exposed to sunlight. So we have to, this younger population, we have to tell them about, you have to do some outdoor activities. And those who already developed virus with pain, definitely bracing is must. Without pain, at proper quadriceps exercise and hamstring also 70:40 ratio we do, 70:30 ratio that has to be done. People, most of them, they just do quadriceps and get away. Hamstring is also equally important. So they have to balance on that, and that will prevent their arthritis in the future. If they're high in BMI side, varus knee, it is important they have to lose some weight. Okay.
Thank you.
So
Thank you
people
so
who are
much.
beyond the control limit, then there are now a lot of methods like injection Manjaro, bariatric, so many things are there. Yeah, so they have to manage if they cannot do with their diet restriction and exercise program.
Thank you,
Yeah,
doctor.
Dr. Anupur.
I will just add small thing to Dr. Dayanand Singh. There's a condition called Blount's disease. It's a part of the medial
Blonde.
artery.
Yeah.
And of course, one of the things that we often miss out is the varus and valgus deformity of the hip. So see the anteversion. So it's one of the things that we have to see and make sure that there is no angular deformity of the hip, femoral head and neck. Sometimes they just appear as if it's a valgus deformity of the knee. It has happened to me a few times.
Yeah,
That
sir,
there is
most of them,
Yes,
of them have, most children, those who sit in W position and all, they have excess
Correct.
anteversion. And most of them get corrected by the age of 12.
That's right.
Yeah, if they are still persisting after 12, that means it is abnormal. We do rotational osteotomy and make it neutral to prevent future arthritis and malalignment.
That's right.
So that should be taken care. And if you look at in the society, in a railway station or in an airport, you still see people with in-towing gait. So they have got residual, they are prone for arthritis.
Yeah.
Very interesting
Thank you.
purpose.
Very interesting.
And
Thank
before
you.
we will go leave our part, I would like to inform to all the viewers across the world that Dr. Dayanand is working in a hospital which is doing totally free of cost. That is of Sri Madhusudan Sai Institute of Medical Services and Research, where even the surgeries are done free of cost, and everything. There is no billing counter in that hospital. Yes, Dr. Dayanand, you would like to add something in that?
Yeah, infrastructure is like better than any of the corporate setup. And even our all operation theaters are modular, and we do all the surgeries free of cost. But if somebody has got insurance and all, for sustainability, we do apply for the insurance. Those who doesn't have money, BPL card holders, they all come and get the full treatment free of cost. And if they have said this Pradhan Mantri Arogya Yojana and all, we do try to reimburse some. Otherwise, those who doesn't have anything, we treat them 100% free of cost. OPD is free, and we have a very high-end equipment. MRI is only, we have 5 MRIs equivalent to ours in whole of the country. Okay, and excellent setup, and half our doctors from UK, they are working free of cost with us, and half Singapore team, UK, Little Art Foundation, everyone comes and gives a helping hand, and we do 100% free surgeries. Yeah.
Wonderful. That's very wonderful.
And
Thank you
if
so
somebody
much.
really
Yes.
cannot afford, and you can refer to us, we can counsel and do our level best. Unless it is going beyond few lakhs, then we try to get some CSR funding and do it. Otherwise, we do, if less than a lakh, we do really free work, 100%.
Wonderful. Thank you so much. Thank you, Rotarian Lalji, for bringing today's guests, and we look forward for more. Thank you, Dr. Dayanand, and thank you, Dr.
Thank you,
Supriya,
thank you, thank you. Thank you.
for joining us. And please stay around as we move from India to another part of the world, UK, with Riddhi, our regular guest contributor, as well as our episode producer for yoga and meditation. A very warm welcome to you, Riddhi. Global Namaste, a very good evening, and a warm welcome, Riddhi. How are
Global
you?
Namaste, and what a wonderful discussion we've had so far on the
Yeah.
causes of arthritis, osteoarthritis, and rheumatoid arthritis. To hear from Dr. Supriya and to actually go into some of the causes behind it as well. I just wanted to add a few quick cents on yoga, being a yoga therapist myself, before we move on. So a lot of the times what I've actually seen when I've been working with clients is that it's usually this nerval joint. So something like the elbow, which is affected. And the symptoms around this are usually pain, redness, swelling, stiffness, also in a ball and socket joint, such as the shoulder blades, for example. They're actually limited in their movements. So one of the first things that we do is to start to work on Sukshma Vyamas. And Sukshma Vyamas are loosening exercises. So a lot of the times arthritis is characterized by stiffness, by tightness in these joints. Clients can't move so well, they find themselves very restricted. So this is actually a fantastic way to start to get them to open. And it could even be something as simple as just rotating the wrists, rotating the hands, and going the opposite way. And the beauty of this is that it starts to work on the joints in the fingers. A lot of the times the stiffness is in the fingers, it's in the toes. So we're starting to open that up. We're starting to loosen the pain that happens around the shoulders by keeping the arm nice and straight. And we're actually starting to loosen up the shoulder blades as well. It's some of the common ailments that somebody with rheumatoid arthritis actually suffers from. Secondly, the pace of life that people tend to have, this fast-paced, busy lifestyle where a lot of the times they have to be adjusting very quickly to different circumstances. And stress is really the demand of that situation, the emotions that are stuck within the system that the system can't help actually work with. So it affects us on an autoimmunity level. Now, very briefly, autoimmunity is when all of these emotions
are getting stuck in the mind in the hypothalamus, and from that is causing chemicals to drift down into the bloodstream and causing ailments to happen, inflammation, redness, pain, for example. So one of the really quick things that yoga also teaches is something called anuloma viloma, or alternate nostril breathing. And doing alternate nostril breathing alongside something like Ujjayi, so 6 seconds in, 6 seconds out, ensuring that the whole system is actually working efficiently. So from the stomach to the chest to the upper chest, and as they exhale, ensuring that all of the breath is leaving the body. So it's a full inhalation, a full exhalation, emptying completely to ensure that any of the remaining ailments that they are holding on to start to dissipate. Now, how does this work? Because actually, when they're starting to focus on their breathing, it also slows down their rate of mind. By actually slowing down the thoughts that are in their mind, they're starting to become more centered, more grounded, more available to actually what's happening in the present moment. And that is so important as well with yoga, to be able to really come down and really to be able to ground and center. Also, something called meditation. I actually teach something called meditation or cyclic meditation, which is working a lot with your breath. So working alongside having conscious movements, which Heather will teach us very shortly as well, through her different system of working with this, which I am so excited about. But also to be able to link your movements with your breath, and to be able to synchronize this properly and effectively, which again works on a whole vagal tone simulation. It helps to relax, it helps to digest, and to let go of any of those remaining ailments that we're holding on to. And really starting to look at life in a positive, starting to fall in love with what we do, starting to fall in love with nature, with the creation around us, and really just being able to unlock some of that stuff that we're holding on to for so long, which is what's causing the osteoarthritis. A lot of the times, as we heard earlier, it's the cold climates, it's sitting at the desk for a really long time. But actually, by doing these different Sukshma Vyamas, which are helping to loosen, which are helping to work with the tightness, to be able to reduce some of that stiffness, to be able to reduce some of that tightness, what it's actually doing is starting to reset the whole of the nervous system. It's starting to reset the whole of the vagal tone. And by doing that, we're not only just working now with the mind, but the vagal tone that goes all the way back down to the spinal cords, back down to your legs, even back down into your ankles, because the whole thing is linked by fascia. And that is the beauty behind this, is just how quickly, by actually doing some of these exercises, can we start to actually reset? And can we actually start to be present and to be centered in that moment to deal with whatever is happening by just centering? And that is actually the beauty of beginning. It's the very top of the iceberg, but it's beginning to deal with some of that stiffness, some of that pain, some of that tension, to be able to let go, to be able to free, to be able to ease, and to be able to just be. And that is the most important thing that I actually leave with people with today, is the brilliance of just being present in the present moment, being able to ground, being able to center, going for walks in nature, to be able to reset the different pressure points in the feet, to be able to realign our nervous system, to be able to breathe deeply, consciously, moving our body consciously, aligning with our breath, and to be able to reset the vagal tone and the nervous system. And that, my friends, in a really quick snapshot, is the beauty of yoga. Without further ado, I wanted to introduce our next guest, which is Heather Diatley. And it gives me great pleasure to move over to Heather as well. Heather is usually in Israel, but I believe that she is actually away in Italy at the moment, on a retreat and doing some fantastic work out there. Heather Diatley actually blends her love of poetry. She does really well with actually working with the emotional side, the emotional cortex of an individual, to be able to free them of those burdens. And she does that through movement, through dance, and through somatics and neuroscience. And that really is the beauty of it. As I was mentioning earlier, to be able to link your breath to your movements and to really start to actually let go. And she does that through her body, through poetry, weaving her training in with a love method, which I'm sure she'll explain, a method that's connected to the Feldenkrais, which is starting to work with fascia on a really deep level, and dance. And she curates intuitive and soulful movement journeys on land, in water, in the air, with horses, really being in nature and really being connected. Heather is fascinated by the quantum powers of fascia and integrates it into her practice. And I'm sure she's going to tell us a little bit more about fascia, how it works, and even perhaps give us some practical demonstrations. A global namaste to you, Heather. Welcome here to Healing Our Earth. And the floor is now yours.
Global
Go ahead.
Namaste.
Global Namaste.
Global
Thank you.
Namaste, a very warm welcome.
Thank you, Amrita, and thank you, Riddhi, and the other members of this incredible, extraordinary community that I feel so blessed to have been introduced to by my friend and colleague, Rina Shoshana, who's a regular contributor. So I'm very happy to be here. Very happy to be here. So, all right, many of us have been sitting for an extended period at this point. So I want to invite, can you hear me okay? I heard another.
Yes, yes, yes.
We can hear you. Go ahead.
Okay. So I invite a sensory landing. And what we're going to do, what I invite you to do, is just drop into your senses. We'll start with our sight. So activating our vision and just coming into that ocular space of the eyes. And I just invite you to look around the full expanse of the room. So much attention has been focused on the screen for the better part of however many hours you've been sitting, or minutes, it doesn't matter. Or if you're listening to the recording, use this as an opportunity to really land in your body. So I invite you to find 5 things in your current environment. Just identify the shape, name it. Don't think about it too much. Let it be organic and really natural. So just identify 5 things with the encouragement to use rotation to come more fully into the space. And from that space of having activated the eyes, let's drop in to the ears, going into the auricular space of the ears and activating all these incredibly intricate and small muscles of the ear, and come into a space of really deep listening where you can hear and tune into 4 different sounds that you hear in the space, even if it's something as simple as the inhalation and exhalation of your breath. Again, not thinking too much, really dropping into that sensory space of the body. And from the ears, we're going to come to the nose, and I invite you to find 3 scents within the current space. With our olfactory, our sense of smell being so intimately connected to memory. So if you have a glass of tea, something that you can easily grab and just inhale that scent and see what comes up. Root yourself through the olfactory space. And then coming in to our sensation of touch. We're often misinformed in terms of the skin being our largest organ. It's actually fascia. We'll talk about that a little bit more. But come into your flesh, that which you interact with the physical environment. And it doesn't have to be just through your hands. It can be the sensation of your clothing on the backspace of your body, or touching the table or whatever you have in front of you. Just come into the sensation of touch through the flesh on your body. Even the sensation of hair on your head. What does that feel like? We often take these sorts of sensations for granted. And then lastly, coming in to the mouth and the incredible sensation that comes through our tongue, one of the strongest muscles in the body. But just drop into the sensation of taste and check in with what you're tasting in your mouth right now. Or if you're not able to really taste anything clear, you can always recall a memory of a pleasure, a taste that's full of pleasure, that has good memories, chocolate, something sweet, a fruit since it's summertime. Just come into that space of taste. with all these invitations of coming into your sensory experience within this body as really an invitation to start to prime the fascia, because the fascia is so intimately connected to each of these sensory mechanisms. Proprioception is a really strong element in fascia as well. I'll talk a little bit more about that. And from that place of having really landed in a sensorial space in your body, hopefully even just a bit, I invite you to really come into your hands and just take a moment to witness your hands, to just trace the contours of your hands. Make it a movement, make it something physical. I invite you to really touch the hands. This is one way to engage with fascia, and one way to initiate myofascial release is through this level of touch and observation. So I really invite you to come into the hands and just observe the contours, observing the veins and the tendons, the terrain of the knuckles, and use it as an opportunity to reflect on all that your hands have held in this lifetime, all that you've cherished with these hands, with the incredible neuroreceptors that we have in the fingers and the palms of our hand. They're even more sensitive and transmit even more information than our eyes. So I invite you to just take a moment to come into the hands again, in really inviting touch as a mechanism for connection and meditation of the power of the hands. And as an initial entry point into really connecting with the fascia too. Especially in the palm of the hands. There's a lot that can be released and observed fascially in the palm of the hands. And I invite you to, now that you've connected with your individual hands, these 10 fingers and these 2 palms, I invite you to imagine a connection of all of our hands, those of us who are on the call. I'm not sure how many there are right now. We have 11 of us on the call right now, but I invite those of you who are listening to the recording as well to imagine a line of connection through all of our hands, that all the members of this community of Healing Our Earth are connecting literally through the mechanism of our hands. Through, in this case, mirror neurons is a really beautiful way of imagining the connection, that even as we're observing each other moving with our hands in this platform, we're still connecting through our mirror neurons. So imagine this connective element of our hands through a larger continuum of space and time. And from that space, I invite you to just generate some friction in your hands, warm up the palms of your hands. By generating this friction and this movement, we're activating the piezoelectric nature of fascia. We are conducting electricity within our system and transmitting an immense array of information through our fascial network. So with that activation of the piezoelectric nature of fascia and the warmth, just the calming sensation of the warmth of the hands, I invite you to bring your hands to your eyes, placing the palms of your hands on your eyes. This is a technique called palming that helps in inducing a parasympathetic response. But more importantly, it's just inviting the eyes to really rest in the back of the sockets, to just give them a break. And especially when we have so much screen time, it can be really helpful to drop into that space and give our eyes an opportunity to not have any stimulation, because stimulation can often be an assault on the system that contributes to the inflammation that so many of my colleagues here on this call have been speaking to today. So just invite that deep drop in of the eyes. And ideally, you would be doing this for like 1 to 3 minutes or even longer, but just because of the nature of this call, I invite you to slowly remove the palms of your hands from the eyes, keeping the eyes closed, but really inviting, as you prepare to open your eyes, inviting a new sense of vision to infuse your body, recognizing that we have fascial tissue in our eyes. So we just gave an opportunity and transmitted information to the fascia of our eyes through that exercise of the palming. So as you prepare to open the eyes, invite that new vision, that new activation of vision to really come forth. And as you're ready, open the eyes slowly and gently, and reintegrating into the space one more time. Again, activating like a full 360-degree observation of your physical space with this new vision. Just observing any differences from before. And that can be a really powerful exercise. Again, I encourage you to do it multiple times a day, especially if you're on the computer. So let's drop into our breathing. Another important element of fascia is oxygenation of the system. Riddhi spoke to the advantages of single nostril breathing, which I plan to do with you all. So let's go ahead and dive into that, where you're covering one nostril and inhaling through the opposite in your own rhythm, in your own time. And then preparing for the exhale by closing the opposite nostril. You can do 2 or 3 rounds of this, again, just in relationship to the short time we have together today. So inhaling, and then switching the nostril to exhale on the opposite side. And completing the last inhalation and exhalation as you're ready. Following your own rhythm of breath, really honoring that and recognizing the extension of capacity that you're initiating and inviting in the capacity of your lungs and your lungs' relationship to oxygen. Again, super important as it relates to fascia. When my son was a month old, he contracted CMV and developed bronchiolitis. He was in the hospital for 3 days. And I was holding this month-old newborn baby who was having such a difficult time breathing. I would say to him, oxygenate, expand, and breathe. And that became the mantra that we would repeat. So I invite you to consider that as you're doing whatever breathing exercise that resonates with you. This is just one example. There are many. Box breath is another good example. And then lastly, let's come into sound. I invite you to, don't be shy, and drop into lower octaves of some vowel sounds. So let's go ahead and start with our taking a deep breath and just releasing a really low octave of an following the up with an a. Hold it out as long as you can. Ideally, we're going into that state of full expression of the octave of the vowel. But again, we have limited time, so we're just going to continue. And moving into the ah. E. Really let it come into the thoracic cavity and feel the resonant structure of the thoracic cavity. We're transmitting sound not only through bone, but through fascia as well. E. O. And coming into the final sound of the ooh. One more repetition. Follow along with me as you're inspired to. A. Ah. Let it be even stronger than the first round. E. O. Ooh. So the power of sound is a really integral element of fascia. Since fascia has a semiconductive nature, it transmits information. Not only can it generate electricity, but it has the capacity to transmit information at the speed of sound. So sound, making fascia essentially a very resonant structure in our body. So sound is a very powerful mechanism to use in this quest for fascial health and coherence. So let's talk a little bit about arthritis and what is arthritis. As I see it, I would like to propose, in addition to what all of these incredible practitioners have offered today, I want to offer a slight shift in perspective. Riddhi spoke to this a little bit, but I'd like to examine or consider arthritis as the body's brilliant response to circumstances and environments that fundamentally don't support it. As Riddhi spoke to a little bit, the element of stress is predominant in the creation of these states of dis-ease, of which arthritis is one. So since we have a society essentially where most of us live that is fundamentally violent, if you consider speed as an expression of violence, it's a continual assault on the system. And the system, the nervous system, the fascial system, every system with the lymphatic system, certainly as well, doesn't have time to fully recover and integrate from the assault. So one of the essential components of maintaining fascial health is slowing down. So one mechanism to do that is obviously the breath. Again, Riddhi spoke to this as well. But slowing down through breath and in introducing slow and steady movements is the perfect antidote to the assault and the violence that we so often experience in our modern world. So it makes sense that arthritis is revealing itself in response to the current circumstances and dynamics that so many of us live in. I think it's a brilliant response of the body. And I think it allows and invites a sense of compassion for those who are suffering from it, and also an invitation to shift their relationship to certain lifestyle changes, certain lifestyle aspects. I would also offer that arthritis and any expression of dis-ease that impedes motor function in the body is a suppression of movement potential. Not Alzheimer's, ALS and Parkinson's being other key examples of chronic states where the movement potential within a body has not fully been expressed, and it's manifesting through inflammation, stasis, stagnation, and dehydration, all of which can contribute to what we pathologize essentially as arthritis and joint pain, whether it's rheumatoid arthritis, whatever expression it is. It does matter, but we're looking at just a broader continuum, generally speaking. So let's talk a little bit more about fascia and what it is, why it's important. Fascia is this extraordinary web of interconnective tissue that literally is a structure, a matrix of tensegrity throughout our body that connects everything from lymph to blood to bone to teeth. I mentioned our eyes earlier, obviously our muscles and our tendons, our ligaments, everything has this relationship to fascia. Again, this piezoelectric structure that is really tensile. It has a resilience to it. And to give you a visual element, I want you to feel it in your body and imagine, because we're talking about sensorial experiences and input, imagine a chicken breast. This is the best analogy. Imagine a chicken breast that you're preparing for dinner. That white sort of tensile tissue on top is the fascia of the chicken. Every living structure has fascia. And again, it's this interconnected web of collagen-like fiber, basically. It consists of a triple helix structure that has nanotubules that make up the helix, thus making it ideal for quantum communication. Fascia is our quantum communicator within our body. It is our internalized mycelium network that allows information to travel throughout the entirety of the system. When we see blockages, adhesions, warping of the fascial tissue, it should have a toroidal element to it and have a structured expression that allows communication to fully go through. That's interrupted through adhesions and through densification of fascia. When you have the densification of fascia, that's when the communication gets blocked and we see conditions like arthritis, etc. So how can we support our fascial health? How can we invite a relationship with fascia where we trust, we cherish, and we charge the fascia? So I'll offer for your consideration 5 pillars to support fascial health. Number one is hydration, and that's not just about, this has been mentioned by other practitioners in this call as well, but I'll add a slightly additional element to it. Hydration is essential. So yes, drinking water. If you're not drinking, if you haven't taken a sip in a while, hydrate by all means. But what we're talking about in relationship to fascia is structured water, that water that exists in the EZ zone of the interstitial spaces of fascial cells, basically. Structured water has an additional hydrogen molecule. It's an H3O2 construct, and the makeup of it is more plasma-like. It's more viscous in nature. So it's not like your typical water that we experience on a day-to-day basis. One way to support that structured water, recognizing that fascia is essentially a water reservoir. It contains like 75% of the structured water in our body. We want to support and regenerate that reservoir as much as possible. So how do we do that? One is through sound, which we went through one example of the lower octaves that can really offer vagal toning and that dropping in of parasympathetic response. With the idea, again, that fascia has that resonant structure built into it. It is a natural sound conductor. We can feel the sensation of it, especially in the thoracic cavity. There's such an extraordinary resonance in that cavity. And it's not just bone, again, the fascia is playing a key role. So we have hydration, the restoration of structured water that is so essential to fascial health, cherishing and trusting our fascial health. Sound being another one, breath we talked about as well. We want to expand that capacity to oxygenate, expand, and breathe every cell of our being. Movement, thus the primary topic of my talk today. How can we support fascia through movement? We kind of did a little bit of it through this really focused attention on the hands, coming into the hands by way of massage. It's not even massage, it's really, if you're doing it through self-touch, it's really a matter of, it's an invitation to play and to get really curious about the structure that you have. You can certainly receive touch through others, but I think the most powerful way to initiate the restoration of the integrity of fascia is through self-touch. So I strongly encourage that with any of the patients I work with, to really explore it on their own and to come from a place of curiosity and connection. So, and the movement with supporting fascia doesn't have to be big. This is the beauty and the magic of it. Simple micro movements. Really offered some simple examples of just circles in the wrists, activating those, 27 bones, 29 joints, and 123 ligaments of the hands. Just coming into that through small movements can be really powerful, and you're regenerating that structured water supply in the hands just through these simple movements. The idea being that with movement to support fascia, we want it slow and steady. Those are the best allies of fascial health that you can really offer. So I invite you to come again to your body. Yeah. Am I up on time?
Yes,
Yes.
that's
Okay.
fine. That's good.
I'm finishing up very quickly. Okay. So let's come into the arms. I invite you to bring your arms to the side with a full integration of all of the senses, all of the sounding that we've done thus far, the breath work. Just come into the arms, bring them to the side, and imagine that you have a ball. If you're familiar with contact juggling, those beautiful crystal balls where they do these crazy skills and tricks. So imagine that you're bringing that sensation of a traveling ball through your arms. We're just going to focus on the arms and the hands in this case. We're just focusing on upper body. So moving that ball from one hand down the forearm, down the elbow, traversing the full terrain of the arm, and feeling the sensation along the clavicle, and allowing and inviting the ball to travel to the opposite side, with the idea being that we're using toroidal movement that's circular in nature, that's multidimensional, multilinear. It's not working within confines of corners. We're using circular and spiral-based movement to really hydrate the fascia, and inviting the ball to finally reach its terminus point at the opposite hand. And you can play with the addition of additional balls as well. This is where imagination is really key with fascia as well, because it's so conscious. Get into a state of play with movement. And then the last pillar that I'll offer to finish is grounding, getting on the earth, getting under waterfalls, moving in this savory way under these spaces that really support the reduction of inflammation in the system. It's the best way you can cherish and trust your fascia. Thank you for this opportunity. It's been a pleasure.
Thank you,
Thank
Heather.
you.
It's been fantastic to learn about just how much water we actually have, 75% in the body, and how we can actually work with our water body in different ways to be able to activate the fascia on different levels, be that through sound resonance, be that through actually working with different layers of the body, be that through movement. And it's just fantastic to see how easy and how simple it is to be able to break down some of these exercises and to be able to do them on a daily basis. I really do encourage our viewers today, whether you're watching on social media, Facebook, Twitter, YouTube, to actually experiment with this and to do what feels right for you. Pick a technique. It doesn't have to be hard, but just start to invite the play into your lives. Start to invite that sense of movement into your lives and see what you can actually achieve with that. And I think that is fantastic. So Heather, thank you once again for joining us and sharing so much knowledge and so much wisdom with us. I also wanted to invite Dr. Donada on today as well. Dr. Donalda was going to talk to us about healing without pills as a holistic remedy.
Yeah, Riddhi, she will join in a
joint
while
pain.
actually. She'll be joining in some time.
She
And
has
let's
joined us
take up.
already. She is on with us.
Yes, she'll be joining very soon again. Let's have comments from Sharon. It was really lovely, Heather, to have you and the kind of concept you have shared with all of viewers in relation to the fascia, and that's so important. It's just so important to let people know about what is inside them, apart from the general cartilage or the general water, but there's much more that holds at so many points. And I could see Sharon moving with the beats of yours actually, and your words made her move in that way as well, which is so lovely. And Sharon already you've been a dancer, Sharon. You already go through so many things and you are so much into the knowledge of holistic healing by yourself. What are your viewpoints about Heather, about what she has been talking, and how do these things align with your thoughts? Over to you for a few minutes. Thank you. And a very global
Heather, that was
namaste.
fantastic. I wish every person that has arthritis could listen to what you just said. Let's see, when I started dancing when I was born. My mom was a tap dancer. And as soon as I could walk, she started teaching me. And then I was in classes and ballet and everything. And then, of course, I ended up in India with my Guruji Sitara Devi. And that was very intense. I have been through 2 hip replacements. That happens to many of us dancers. My mode of healing has been rolfing, which really is wonderful for working with the fascia. Feldenkrais, I'm trained in that, which really brings consciousness into the tissues and gives you these exercises like what you were doing that really help with movement. So when my hips were starting to go and I could hardly even turn out my legs, I really used those Feldenkrais exercises, those very simple, very focused exercises to keep them going. In fact, when I went to the doctor, he said, well, you must be one of those mind-body people, because I can't believe you're not on drugs. And the other thing that I did that was very interesting, because you were talking about sound, was I would sit with a small tanpura in the bowl of my pelvis. And then I would play it and feel the vibration in my whole abdominal area, and also sing mantras. So I've worked with arthritis in myself, being a dancer, and it's in my family. And everything that you said, I totally agree with. And it's just a joy to have you on here today.
Thank you. Thank you so much, Sharon. Thank you, Heather, for joining us. Please stay around as we move with our next guest, Danada, before we talk with Sharon and Will Douglas, who have joined us for sharing more insights on arthritis and inflammation. Over to you, Riddhi. Thank you.
Sharon, before we move on to Danada, I just want to say that that is such an intuitive share, and it's just fantastic to see as well the movements that you've been through to actually start to produce your own movies and to start to really work with dance in different ways, to be able to release and to let go and to just bring people into the present moment with your wonder and your just intuitive movements that you come up with. They're so intuitively timed. And stick around, we are going to come back to you, but we're just going to go to Danada very shortly to see what wisdom and what magic she has with us, for us even here today. And it's fantastic to just hear about her healing without pills, pain without pills, causing holistic relief for arthritis and joint pain. And Dr. Danada herself works intuitively with acupuncture, herbal medicines, Ayurveda, and integrative therapies. She's a part of many different boards and organizations and just teachings through her work on medicines and Ayurveda together, how Ayurveda fills in the gaps in modern medicine. And it's a great privilege to actually have Dr. Danada here with us today to share her wisdom on arthritis and joint pain. A global namaste, Dr. Danada. Welcome.
Global
Global
namaste, Dr.
namaste.
Danada.
Global namaste. Global namaste. Good morning, good afternoon, good evening to everyone,
Good
wherever we
afternoon,
are.
good morning. Good morning.
So the topic is very near to me because I have seen my mom suffered very closely with the arthritis and joint pain. And at the end of the day, it's a very crucial to find a first line of treatment, what we should do. You know, when Riddhi told me about this topic, I said, I have many thoughts about how we could do it without pills, how we could relieve the pain without pills. Because wherever there is a pain, the first thing that comes in our mind, what it is coming, is pills. I can take painkillers, I can take some anti-inflammatory drugs, or I can take some steroidal drug. That's the first choice that it is hardly to see anybody that is not addressing without this. But if we continue to grow into this, the arthritis today affects millions of people worldwide. And for many, the first line of treatment is often pills. But in Ayurveda and other integrative sciences, do you know that you could successfully address the root cause and get rid of the pills? That will be the path to real healing and sustainable relief. In my clinic, I see a lot of arthritis conditions. In Ayurveda, we adapt them as a Sandhivat. We also adapt them as aggravation or a more of a Vata dosha increasing in the joints. Vata, when imbalance, brings dryness, stiffness, pain, and exactly the symptoms that we see in osteoporosis, osteoarthritis, other degenerative joint conditions as well. Parallel to joint issue, there is also very famous in Ayurveda, a big chapter written by Charaka called Amavat, which is parallel to in today's world, say rheumatoid arthritis, or the biggest vata imbalance as a immunomodulatory disease, which leads to inflammation, swelling, stiffness. Now, what does Ayurveda teaches us? All of you known and you've been there into the holistic medicine. The first thing Ayurveda teaches us to treat the root cause, not just the symptoms. So instead of looking at suppressing the pain, how do we balance balance this vata and remove the ama? Basically, ama is a lot of toxicity, which is undigested food material, undigested thoughts, emotions, cellular level to the subtle level, which nourishes not only our tissues, dhatus, but our mind and our deep spirit as well. So, how does I treat people without peel into my practice? First choice is through the diet. Okay, so warm, cooked, easy to digest food with spices like ginger, turmeric, reduces inflammation, improves agni, and improve the digestive fire. What happens if we improve the digestive fire? It's because it will engulf all the toxicity and the vata will start diminishing, which means our inflammatory responses to our body will come down. And that is why in United States, ginger, turmeric, black pepper are billion-dollar industry in the herbal supplements. We are selling turmeric as a curcumin. A big integrative medicine sells a lot of ginger-based spices that improves and proven in Ayurveda long back as an anti-inflammatory, immunomodulatory, antitoxins to take care and nourish the whole system. So first of all, look at a person's diet. That's the most important thing I do. Second I do is I address it with the herbs. Now, as we eat our diets, they're all roots and vegetables, and obviously we add some of the good kind of meats and other lot of other dairy products. But at the same time, classical books gives us a remedies into bigger and better complexities of these herbs, where both traditionally and modern research shows that it is helpful in reducing pain and swelling. Which are those herbs? Google is my first choice. So Google is not a Google, by the way. It's a Google. Google is a Sanskrit name for a resin herb that the resin oozes out of the tree, and that we refines and is very helpful in reducing the pain and reducing swelling. It's specially designed for arthritis. The second choice is called Shallaki, which is a Boswellia. Boswellia is phenomenal established into chemical synthesis that helps the joint to soothen, increases the lubricant into the system, and helps the pain. Now, as I told you, adding ashwagandha or other anti-anxiety or other calming portions, jatamansi and all, that helps a person to relieve as a muscular relaxant, which helps the brain to calm down, which helps muscle to get relaxed. And that portion is very important. And that is done by the herbs like ashwagandhas and all of these. So you're not only looking person's pain and swelling, but the agony behind that, the irritability behind that pain is also very, very important. Now, third thing I address it with, once the person is good on diet, we kind of take over a little bit with the herbs, digestion gets better, then it is time to expel the toxicity from your system, because that is our root cause, right? So we do that through the therapies. Ayurveda has a phenomenal science into how to cleanse your body. We call them as a pancha karma. Pancha means 5, karma means actions. So 5 different bigger actions to cleanse your system, especially for arthritis treatments like basti. Because Ayurveda, in Charaka, Ayurveda related vata disorders related organ is basically your colon. So it is given that 8 feet long colon resides, and if it improves into better lubrication, better gut microbiomes, better health, then you overall looking your joints to be supple. And as you know, in Bhagavad Gita also, Lord Krishna said, Urdhva Mula Adha Shakha. It's the same philosophy here, a spiritual aspect or a health aspect, that we have to treat not our shakhas, not our hands and joints as a main treatment alignment, but look into the guts, look into the root of our whole body. So our root is not a brain, our root is not our hands and joints, our roots are guts. And it has been not told by Dr. Kulkarni, it is told by Dr. Charaka. It's a long backstory. So what we do, we cleanse the colon with medicated oils, medicated decoctions, which is classically prescribed into the classical Ayurveda books. And these are many, like according to your prakriti, according to your type of a pain, according to your symptoms, we can design that. And the most important part, if the ama is not involved, we also help people to lubricate their body in and out. So the vata problem, arthritis, the mantra is to oleate, oleate, oleate. But one has to be really go through a Vaidya who is a learned Ayurvedic physician to know if the swelled joints are already having ama in it. If there is a ama present, and if you put oil more, the pain increases. So you have to first deal with the ama, which is toxins in the system. Okay, and that's more of a complex knowledge. Let's not get into that. But remember, deeply nourishing and lubricating the joints while calming the vata is the third thing I do in my practice. And the last thing that Heather and other people I have seen, I just joined daily practices. She's shown phenomenal breath work, phenomenally gentle yoga, pranayam, meditation, keeping yourself in lifestyle rhythm, eating good for your own prakriti. That brings the beauty of all of this lies into all these four integrations. So Ayurveda could combine into physiotherapy. Ayurveda could combine into modern toolkit as when you are taking the pills, how you can go from that journey to without pills. Ayurveda also can combine with the acupuncture and some Chinese good herbs that enhances circulation and reduces the inflammation. I think together, this integration will offer patients the pain relief without depending on much of a higher costly and drugs to your body, which always dependency happened on steroidal drugs or antidepressant drug or painkiller drugs from pharmaceuticals. One last close timeless verse that Charaka given, I would like to say here, is the root of the treatment is not suppressing the symptoms, but in removing the cause. And that's a Sanskrit word. Let us remember, pain without pill is possible. Okay, arthritis, pain without pill is possible with this approach. Thank you so much.
Thank you, Dr. Dhanada. That was
No, that is
very
really
wonderful
wonderful.
tips. Yeah.
I just
Sorry,
want to ask
did
you.
my video go off all the time?
Yeah, your video
I was
was
going to
off,
say, I
but
just
still
want to
we could
ask you
see
why
you.
you weren't on video.
Oh my God, because I joined from my mobile phone, I didn't even notice that I was off on the video.
Just a question for our viewers that are watching at home. You mentioned a couple of herbs there. You mentioned Google as being one of them. How is that spelled? What's the spelling?
Guggul.
Okay. And you mentioned
That's
another
without
one
the
as well,
O.
beginning
That's
with
without
S.
the O.
That's without O, double G's.
Yeah.
And you mentioned one more that was beginning with S.
Shallaki.
How is that spelled?
It's the English name for that is very famous called Boswellia.
Boswellia
I can Boswellia salad. I can type in if you would like there.
Yeah.
Fabulous. So that's just for our viewers at home to be able to look this up if they want to go a little bit deeper into the herbs of it. And that, as you've explained, the root cause of it is really the gut, and it's to really start to work with the gut microbiome to be able to change that, to be able to alter the state, and to be able to reduce the ama and the toxins that are in the body, which is what's causing the vata imbalances to begin in the first place. So by having a combined approach of all of these different things is really good. And I think you've just typed it into the chat as well. I'll read it out for our viewers at home. So Gugulu, which is Gugulu, and Shalaki, which is Boswellia, Shalaki is spelled SHALLAKI. That's SHALLAKI, and Boswellia, BOSWELLIA. And she's also mentioned here turmeric as well, which validates both traditionally and modern research and reducing pain and swelling. So Dr. Dhanada, it's been fascinating to speak with you here today and to learn more about what you're doing in your practice, to be able to help clients that are struggling with arthritis, and to be able to just find that sense of ease, to be able to correct their vata dosha, and to be able to come back to a state of balance. Be that through different things like Bustry, for example, and really starting to clean out the colon and starting to reduce those symptoms, being able to work with the gut microbiome through not just pills, because this is actually without actually having to even go to pills, just be able to work on a human-to-human connection level and to be able to start to correct that imbalance. And I think that is such a powerful share.
Yeah. Thank you, Dr. Dhanada, for coming in, and we wish you to see you too often, please. And thank you, Riddhi. Thank you so much for joining, and hope to see you.
Seeing everyone feels really home.
Yes. Thank you so much. Yes, Sharon.
I'd like to say that it looks like Dr. Dhanada will be returning to Crestone. I spoke with Hannah yesterday.
That's very nice. We look forward to. Yes. Thank you so much, Riddhi. Yes, and let's catch up again for our next upcoming episode next week with yoga and meditation, in fact. So, yes. Thank you so much, Dr. Dhanada, and thank you, Riddhi, for joining in. And let's move to US with Sharon as well as with Bill Douglas, whom we have as our next guest. So thank you.
Thank you so much.
Thank you.
Always a joy to see you, Dr. Dhanada.
Always joy, Sharon. I would connect with you again.
Yes. Global Namaste, Bill.
Global Namaste, Bill.
Sorry, I had to push some buttons.
Well, it's always a pleasure to have you here with us. And Bill has been just wonderful in assisting me with Quantum Chi, which is now completed and winning festival awards around the world. And, I love Bill. He's such a promoter of everything we believe in here at Healing Our Earth, particularly with the World Tai Chi and Qigong Day, but also his Global Transformation Project that is about bringing all these wonderful systems of yoga and Tai Chi, Qigong, mindfulness, meditation into schools throughout the world, which is an amazing passion project that we'd love for you to all be part of. And Bill, tell us how they can sign up for this.
Yes, so if you go to globaltransformationproject.org, So if you just go on Google and put in Global Transformation Project, it'll come right to the top. And then you can go there and you can see the science behind this global movement for a United Nations resolution, a non-binding United Nations resolution advocating mind-body education, Tai Chi, Qigong, yoga, meditation, and mindfulness, because those big five, Dr. Herbert Benson spoke about those because they have massive amounts of research behind them. And so the non-binding UN resolution would advocate that public schools all over the world consider a 1 hour a day kindergarten through 12th grade mind-body class, so that every day for an hour kids would be getting in touch with their body. Now children actually are in a meditative state most of the time up to about 10. And then at 10 years old, we start getting acculturated. We start getting more into kind of a fear mindset and a separation and, all the kind of things that we worry about as we get older. But it's very natural for children to be in this state. So these practices, yoga, Tai Chi, Qigong, meditation, mindfulness, they can all be taught in age-appropriate ways, kindergarten all the way through 12th grade. So by the time kids got up to 12th grade and in high school, they would virtually be mind-body masters. And so you can, when you go to globaltransformationproject.org, you can sign the petition. You can look at the science, see how obvious it is that this should have happened a long time ago. And then you can see a draft resolution that we're planning on delivering and inviting every United Nations mission on the planet to become a co-sponsor for the Global Transformation Project to get mind-body education into public education worldwide. And so the reason that we believe this can happen is because in 2014 or 2015, sorry, I can't quite remember, but the United Nations created the International Day of Yoga with a United Nations General Assembly resolution. And that resolution, it made history because it had more co-sponsoring nations than any United Nations resolution in history. So the planet is ready for a big spread of mind-body practices around the planet. And the International Day of Yoga, the UN cited it as an opportunity to increase health and connection and well-being throughout the planet. And so obviously the next step would be to get mind-body practices into public education all over the planet. And so that's what you can become a part of by signing the petition at globaltransformationproject.org. And then also, if you can start spreading this information, start spreading the petition, that is when it'll happen. Our goal is to get at least 100,000 signatures before we go to all the United Nations missions on the planet, because that'll be a lot of work. But really, there's hundreds of millions of people all over the planet that have benefited from mind-body practices. So we believe that at some point, the mind-body community is going to realize that it's time to pay that forward to the next generation. And then this petition will catch fire in the global meditation, yoga, Qigong, mindfulness, and Tai Chi community around the planet. And then people start spreading this petition. And then we'll be able to go to the United Nations with, 1 million or several million signatures from people around the world. And then that'll really make it much more powerful when we go to the United Nations missions.
Wonderful. I'm so excited about this project. It's so necessary. Now, we're here to talk about arthritis, and you know about the science behind Tai Chi, Qigong, and TCM, traditional Chinese medicine, and arthritis. So fill us in, Bill.
Yeah, it's been fascinating listening to the presentations when I got here. One of the things that caught my attention was the situation with fascia and our being hydrated, because water is such a huge part of the fascia. And so what I do in my mind-body classes, I've been teaching in hospital settings for about 40 years. And what I encourage students to do is do what I do most mornings, and that is I shred up some organic ginger root, and then I put it in my cup, and then a little slice of lemon for digestion. And then I just fill that with like super hot water and let it steep for a while. And then I just keep putting hot water in that cup all day long. So I'm drinking ginger water all day long. And then you'll get little pieces of ginger in your mouth and chew them up and eat them. And so I'm always encouraging students to, if you drink coffee every day, try to work in some of this. And have some ginger water, and maybe have days where you just have ginger water, and you'll acquire a taste for it, and it'll taste really good. And then another thing that came into my mind when I was listening to the discussion was on the fascia. And I had been at Harvard in 2023 for an international mind-body event through Osher Medical Center at Harvard. And they had some fascinating presentations, and one of them was on fascia. And one of the presenters was a researcher, and he had live footage of a human being's fascia when that person was experiencing Tai Chi. And what happened was the fascia was very kind of stagnant and rigid. And then as they started practicing the Tai Chi, you could see on the camera, you could see the fascia becoming liquid and waves. I mean, it was really stunning because you were actually seeing it happen. And I'm sure the same thing would be true for yoga. And Sharon's talked about her next documentary project as quantum chi spreads around the world is the Global Transformation Project. So that would look at yoga as well as Tai Chi and Qigong. And, and I'm sure, we actually, I'll get into some of the research here that I was going to share a screen so I can show you guys how to find it yourself. Okay, so now if I can get permission to share.
Yes, please go ahead.
Okay, there we go. All right. Okay, now let me see how to get to the screen I want to get to. Okay. All right, here we are. This is worldtaichiday.org. So this is the official organizing page for World Tai Chi and Qigong Day, which is held every year the last Saturday of April to educate the planet about the science on mind-body. And we've reached about 1 billion people through mass media coverage of World Tai Chi Day events around the world, and then provided Tai Chi teachers around the world with the science on Tai Chi, Qigong, yoga, meditation, and mindfulness, so that when they got those media microphones, they'd be able to educate the public. And the mass media should be doing this, but they don't. And so that's why we created this event. So mind-body practitioners and teachers, we really have to become organizers because it's fallen on us to educate people about this science because they're not getting it through the mainstream media sources where they should be getting it. Okay, so just so you see what I just did is when you go to worldtaichiday.org, at the top there's a tab Tai Chi and Qigong. And if you look under that, then you'll see the medical research. And then when you click on that, there's a lot of really great information here about the Director General of the United Nations World Health Organization advocating Tai Chi, for example. But if you click right here, it says scroll down near the bottom, click here to go directly to Medical Research Library. And then here we are. And so what we have here is we have nearly 100 of the most common health challenges that people face. And when you click on any one of these, what'll happen is it'll take you to a page and it'll show you all the scientific research that we've been collecting over almost 3 decades now on mind-body practices. And so, for example, today's subject, arthritis. So if you go there, if you go to worldtaichiday.org, click on Tai Chi and Qigong and then medical research, and then come to this, you'll see arthritis, and you can click on arthritis. And then you can scroll down through all this research, and we have live links to all the research that we list here. And you can see, just how profoundly Tai Chi and Qigong are proven to help with And it gives arthritis patients a weight-bearing exercise. It's, as far as I know, it's perhaps yoga as well. I'm pretty confident yoga, but other than yoga and Tai Chi, there's not any weight-bearing exercises that people with like knee arthritis, for example, can do without suffering inflammation and reactions from it. But the Tai Chi studies showed that that didn't happen, and I believe I've got something down here that shows that with yoga as well. So if you just scroll down through here, you'll just see the research from all over the world. And so we wanted to create a go-to place where mind-body teachers could be instant experts in all this science. Oh, I think it went a little bit too far. Yeah, there we go. Yeah, there's the some yoga research. Now we're building the yoga research and the mindfulness and meditation research as well. So we had focused on Tai Chi and Qigong research in the beginning. But now another, if I could, Sharon, while I'm sharing a screen, another thing that I wanted to talk about, and I was so glad that it came up in the discussions earlier, and that is the role that our state of consciousness has on arthritis and really every health condition that we face. And fear being a big part of that. And what I was going to show you, maybe I'll show you later, but what we've done is we've looked at the sociological aspects and the consciousness aspects of mind-body practices and human consciousness and these health conditions and things like that. And fear and stress are right at the core of all these things. And one of the things that I just really want to emphasize to mind-body teachers all over the planet is that we're giving our students a false impression of the world because we watch mainstream media. And the problem is what the public opinion polls show, and in my classes, I do stress management classes in corporations a lot. And in my classes, what I ask people is I say, do you think that the world is more dangerous and violent than it's ever been before? Most hands go up. And the public opinion polls reflect that. And the problem with that is well, it's not really a problem, it's great. but the problem with that theory is that it's not true. Violent crime rates are at 40-year lows in the United States and in many countries all over the planet. And sociologists are having a hard time figuring out why that's happening. But through the collection of the science that I've collected, what I've realized, and the science shows it, I have a book called The Gospel of Science, second edition, and it has all this science in it. And what's happened is over the last 40 years, mind-body practices have spread all over the planet like a wildfire. And what the science shows is that when people go into coherent states of consciousness, just a small percentage of the planet going into coherent states of consciousness has an effect throughout the global consciousness, the whole planet. There's a research project called the Global Consciousness Project. It was born out of Princeton Engineering Anomalies Research Laboratory research. And what they found is that when we go into coherent states, large groups of people around the world, and I'm talking about tiny percentage of the world population, it actually increases coherence in the whole global consciousness. And what happens, the Transcendental Meditation Foundation has done lots of research with police departments and universities, and they've found that when you get 1%, the equivalent of 1% of high-level meditators of the city's population, bring in 1% of high-level meditators of their population, it dramatically reduces the violent crime rates in that city. And they've done huge studies with like 48 cities. In every city, they reduced crime compared to the control cities, and the effect lasted for 5 years. So we're seeing a dramatic reduction in violent crime around the planet over the last 40 years. And again, it's not just in the United States, it's in many countries around the world. And I was on a program where we were discussing this, and mind-body teachers were talking about like kind of what was discussed earlier today about, our empathy for our students because they're living in, such a dangerous world. And, and it's hard to feel safe on the streets, but it's not reality. This is all a myth created by mainstream media, because mainstream media figured out if they can get us afraid and upset or fearful, it releases stress chemicals, and then the stress chemicals create kind of an adrenaline high, and we get addicted to that, and then we keep coming back to that mainstream media to get that kind of fear rush, and we don't realize what's going on. It's not conscious. It's subconscious. But I'm always encouraging my mind body students, stop watching mainstream media, because it's fear-based. That's how they get the viewers. And what that does to our fascia and what that does to, our joints and our inflammation is massive. And so it's so important. It is so important for mind body teachers not to be part of that fear mythology, and to get away from mainstream media and start looking at the real data. And I put all the real data in the second edition of the Gospel of Science, so you can see the FBI and the United Nations data. And then you can start telling your students that, no, that's not true. The world is actually, violent crime rates are at 40-year lows. The world is actually vastly less violent than it's ever been before in human history. And that's just an absolute fact. But that's not the message that we're getting from mainstream media. And it's causing all kinds of inflammation and aggravation of the health issues that my students have in their in the hospital classes that I teach. And so I encourage them, just stop watching it. Stop watching it. Find other information sources outside of mainstream media, because that's fear-based. And so it's really important that mind body teachers understand the data and understand the science, because otherwise they're participating with their students in spreading a state of fear that's not reality. And so on Arthritis Day, this is a really important thing for people to be aware of, because lessening that unreal fear, that mythological fear, is going to have a huge impact on our patients and on our students.
Oh, I completely agree. I quit. I quit. And it's just like my whole psyche just feels so much calmer. I mean, instead of watching the news, we should do some meditation or some Tai Chi or some Qigong or some yoga. Just, if you're addicted, just shift the addiction. Just every time you go to do it, just say, okay, now I'm going to do some mantras, or I'm going to do some exercises, or I'm going to dance, or I'm going to sing, or I'm going to just go in nature.
Right. Yeah. Nature is so healing. And then you get that grounding. Somebody was mentioning grounding. Yeah. I just got grounding mats for our computers so that you're grounded with your feet on the mats. But, I mean, just, replacing, your corporate media with programs like Healing Our Earth, or, go on YouTube, Greg Braden, Bruce Lipton, Dr. Joe Dispenza, Yoga with Adrian. I mean, there's this whole beautiful landscape out there I call YouTube the jukebox of the universe, because you can explore any of the most amazing things about the power of human consciousness, and so if you want to sit on the sofa and watch some TV, watch YouTube and investigate things like Healing Our Earth, instead of the fear-based stuff that we're getting all the time. And I'm not Pollyannish. I mean, I know there's things on the planet that we should be concerned about, and we are, and that's why they're happening less, because people are concerned, and that's why violence is becoming less. But it's important that we, as mind-body teachers, come from a place of clarity and reality. And when we come from that place, it's much more calming, and it's much more healthful, and it's much more inspiring. And so, yeah, I kind of encourage my students to try to find alternative viewing things if they want to sit on the sofa and watch something.
Well, that was wonderful.
Now, I will warn teachers, if you tell your students that the world's not as dangerous as they're being led to believe from watching the news, you will get students that will get angry with you. They'll get angry with you, because what it does is it shatters in their mind. It's kind of shattering their whole view of reality, because if it was based on mainstream media's mythological fear-based world. And so sometimes they'll have a reaction, they'll kind of get mad at you, but in the long run, you'll be doing them a lot of good, because it may stick at some point, and then they'll start finding more nurturing information resources.
Yeah.
Like this one.
Thank you, Bill. Lata, do you have a question?
Video.
Yes, let's have a question from Lata, and then we take the video.
Okay.
Lata, you want to ask something?
Oh, you're muted.
Yes,
You're
please.
muted.
Global Namaste, my beloved family, Healing Our Earth.
Namaste.
Namaste, Amrita, Sharon, and Bill. It's always lovely to connect, isn't it? Because we think so alike and we agree in so many things from our life's experiences and our years that have gone by and what we've experienced. And I love the way, Bill, you bring out this fear-mongering thing, you know, that the media and the pharmaceutical world also like to promote, because it's their livelihood, connected to their livelihood, and they monetize from it, don't they? So, which is so sad that some people would rather. So when we come back, I think, to the emotional and the mental state of a person, it's all connected there, because then they believe what the myths are and the fake news is, rather than the clarity and the soothing remedies that we can turn to. And that's where I think the problem is, the root of the problem is affecting the mental state of people. And that's what then creates the crisis in families, because, even though the fear element is lower, but then the families, because they've got joint pains and agony and all this fear-mongering illnesses, and they stay at home locked up, and then they become attacking each other, going for their throats. And that's where the unsafe area is now, is the family life, where people are really not able to communicate because the pain is causing them to become aggressive and impatient and giving them fear-mongering issues, so they take it out on their nearest and dearest. And this is where the element of unsafe could be connected to, and that's where the
Thank you,
cycle
Lata.
is going on, rotating.
Yes,
And
yes,
so we
thank you.
need to break that cycle somehow. And I
Yeah,
think
let's hear from Sharon how can the cycle of this fear be broken by what Sharon has to show to everyone. Thank you so much, Lata.
So I have a video from Lee Holden. Lee Holden
Yes,
is a
please.
Qigong
Thank you, Bill.
teacher
Yes.
who is one of the featured teachers in Quantum Chi. He's a wonderful, really magnetic teacher. He's been on many PBS shows. I need the permission to share.
Yeah.
Okay, what's going on? Go. I can't. Oh, okay, let's see.
Yes,
There.
please go ahead.
Oh, there we go. Oh, here. Where do we go? Okay, where did it go? Okay. What is this?
So it's been a lovely episode, Sharon, and
I'll find this. I don't know. I just makes sense. Here it is.
Arthritis is an ailment that affects millions of people worldwide. We often get arthritis in the hands, the shoulders, the elbows. I'm going to show you a routine mainly for the hands and the upper body that will help to clear congestion. You see, in Chinese medicine, we think of arthritis as stagnation of energy in the joints. They start to get stiff. And here's the principle. If we don't move the body gets stiff, tight, and arthritis can develop. So healthy movement is not only healing, it's also preventative. So let me show you some exercises that will help to open up the flow of energy in your body, especially focusing on your upper body, hands, wrists, shoulders. So we're going to start off like this. I want your palms face up and you're just going to shake like that. Arms open. This is going to open up the wrists and bring some energy to your hands. And we're going to shake vigorously like this. Keep it open. Keep it flowing. Take a couple of nice deep breaths as you do this. It's no problem to go slow. If you have any pain or tension or feels uncomfortable, just slow it down, and it's fine to speed it up as well. Then just turn your hands the other way. Shake, palms face down, and release the other side of the wrist. This is great for the wrists and the hands. Take a nice deep breath. After we do this routine, you're going to feel a lot of chi, a lot of energy in the hands. Relax, relax. And when you bring your hands to your side, can you feel that buzzing, that tingling, that lightness, that improved circulation in the hands? Often you can, just after 2 short exercises. Now the next one we're going to do, I want you to just create a spiral with your wrists, hand over hand like this. And you spread the fingers, so don't have the hands loose. Spread the fingers so we get this energy pumping through, and then try to make a full circle all the way around, spiraling through the wrists. Open your fingers and stretch a little bit. This is what we call invigorating the chi, the life force energy. Go one way and then go the other direction. And we spiral, pump the energy through the hands and the wrists and the fingers. This is very preventative for arthritis, but guess what? It also helps with things like carpal tunnel, tendinitis, any inflammation in the tendons, wrists, or joints. Spiral and relax. Now, often the tension and tightness in the wrists and the hands comes from the upper body and neck. So let's do one for the shoulders. And this one, I want you to just step back with one foot. I'm going to do your mirror image. So you step back with your right foot and left foot forward, and then just shake your shoulder like that. Just get some relaxation in the shoulder, and then bring the shoulder up to the ear, shift the weight back, pull the shoulder back and drop it down. And then just make it real smooth. Shift the weight, lift the shoulder up by the ear and drop it down. Now, as you do this, don't lift your elbow, just the shoulder up by the ear and bring it back and down. This is a great exercise for any tension, pain in the shoulder. It's very simple, and it's something that we call oiling your shoulder joint. It brings healing energy right into your shoulders. I want you to just breathe slow and deep, just relax. And oil that shoulder joint. And as you do this, go ahead and close your eyes and just imagine this warm golden oil moving through your shoulder joint, bringing healing energy there, and getting it to flow. Very good. Couple more times. Let that joint just soak up that improved circulation and that healing energy. Relax, and let's do the other side. So step forward with your right foot, left foot back, shake it out just for a moment, relax your shoulder, your elbow, your wrist, and then do the same action. Shift the weight, shoulder comes up by the ear, pull it back, drop it down. Then I shift my weight forward again, shoulder up by the ear, bring it back and down. Oil the shoulder joint. We do it slowly. Move your body with some mindfulness and use the mind to bring some healing energy into the shoulder. Imagine this warm oil circulating and spiraling through that shoulder joint, loosening things up and bringing healing energy there. Shift the weight, circle the arm. And just breathe deeply and naturally. Let's do it one more time. Shoulder up by the ear. Pull it back and down. Wonderful. And now, let's do a nice flow that's just going to bring energy from the shoulders to the fingertips and open up the meridian lines and clear any stagnation. So we're going to inhale, just float your arms up, just to about shoulder height, and then float your arms down. This is an exercise called flying, and it brings healing energy to the arms and hands, and it brings lightness, relaxation, and clarity to the mind and body. Inhale, float the arms up, nice and soft. Do it slowly. Exhale down. And inhale, float the arms up. Exhale, float the arms down. Feel a nice flow of healing energy into your shoulders, right through the elbows, all the way down through the wrists into your fingertips. Exhale down. Inhale, float the arms up. Slow down your body. Be open and receptive to taking in more energy. Feel it circulating through the arms into your joints. Let's do it one more time. Deep breath. And just bring your hands so the palms face towards each other. I just want you to see if you feel some energy in your hands. If you bring the hands a little closer together and a little further apart. We call this holding a chi ball. Chi is your life force energy. See if you can feel some energy. And if you feel energy, more circulation will go to that part of your body. Relax your hands and just feel and sense that healing energy in your fingertips, in every joint, in your wrists, your elbows, and in your shoulders. Good. Can you feel that? You just did something really good for your mind and your body. Healing happens through circulation of this energy. When we move in the right way, you get to activate your own healing power within yourself. All right, well, I hope you enjoyed that. If you did, subscribe to our station. We got a lot of videos that will teach you exercises for specific parts of your body. And click the like button. We appreciate that. And if you want, we're giving away 2 weeks free to my video class subscription. That's where you get to come to class. It's about an hour long. Included in that is a Qigong healing meditation, as well as a live Q&A where you get to come up and ask me a question on Zoom. I'd love to see you there. Give us your name and email. Click the link, and I'll see you in class. Thanks so much, everybody.
Well, wasn't that wonderful?
Yeah, that was really wonderful. I could see everybody just waving, and this was like really wonderful. The way feeling like a bird. And moreover, Sharon, I think the intensity as well as the speed of movements that we do in our life also makes a very big difference. And that's where the fascia in connection with the musculoskeletal system and the release of hormones, neurotransmitters that work together with that makes a big difference. People are pretty much pushy and energetic in doing things, and moving the hands like this and moving the hands like this makes a very big difference, and especially when you open and then you move. It really has got an intricate relationship with your brain waves, which accelerate your world. So that really is very, very nice. That's really wonderful. I would like to take your last comments before we wind up today's episode. And let's have a couple of comments from our other contributors today as well before we wind up.
Namaste, Ankur. Namaste.
Namaste.
Let's start from you. Yes, let's start from you, Sharon, and then we move to Dr.
Okay.
Anukul and Bill and Riddhi, and then, yes.
First of all, I wanted to say that Lee Holden has a lot of videos on YouTube.
Mhm.
And if you just type in Lee Holden Qigong, you'll get to them. Or you can go to holdenqi.com. I think he's a really wonderful teacher, very dynamic and heartfelt, right, Bill? He's planning, by the way, Bill, to have a big summit in the winter with Quantum Chi and event at his place in Santa Cruz, California. So we're very excited. But this has been a wonderful show today. Arthritis afflicts so many people. I know well, my family. One thing I can tell you is that my mom had really bad arthritis in her knees and everywhere. And unfortunately, even though she had been a dancer, when she got like into her 90s, she pretty much stopped moving. And what I say to everyone, don't stop. Don't stop. What do I say? If you don't move, you lose it or something, use it or lose it. And for me, all of these different complementary techniques for arthritis has been just a lifesaver. It's in my genetics, but dancing really intensely 8 hours a day for many years, it takes some wear and tear, and you need things like all of the things we've been talking about today to really assist you in staying pain-free, and it's possible. That's what I want you to know. But never stop, even if you're just exploring tiny movements with awareness of your fingers. If you have arthritis in your hands, it will help. It will help. So great show today.
Thank you. Dr. Anukul, your last moment comment before we wind up.
Thank you very much. It was such a pleasure listening to everybody. There were one small question that I wanted to ask Lee was, how did you approach the schools to get the children involved in this kind of things? And number two was, I was wanting to discuss and tell somebody about to discuss Chandra Namaskar as a part of stabilizing your pelvis and your hips for different movements of the arthritis. So you can do that next time, but requesting Lee to just tell me about the schools.
I don't.
Yeah.
So, Bill, you can talk about the school, but I can tell you this. I've had Libby Edson has been, we should probably bring her back. She's been on the show, and she has done a whole, with Oregon in the public schools, mostly, I think, Ashland area. She is teaching, what does she call it? Go-yo or yogo or something like that. And I'll send you some information about her. She's now on Telegram, so I'll connect you with her, Uncle, so that you can be in touch with her and how she did that. I know, yoga is becoming more and more integrated into the schools. I brought it in years ago when I worked in New York in many schools, and they wanted me. I was teaching the Ramayana and all these different myths, and what they were doing, they wanted the yoga position. That's always how I began, with yoga poses and meditation. And so more and more there's schools that are actually asking for these things. I only wish I had Qigong at that point, because that's another, the integration of yoga and Qigong is really fantastic.
Yeah. Thank you. Riddhi, your last minute comment.
Sorry, can you hear me now?
Yes.
Yes.
Fantastic. I was going to say I'm actually working with Ashram out in America, San Antonio, and they are all about kids yoga. So part of what we're teaching them is the Chandra Namaskara, the Surya Namaskaras, going through the whole sequences, working specifically with the fascia and how to start to release that through all of the different movements and things. So I think we can connect on that point if you would like. We're also bringing that into the UK, working specifically with school children. We've just had the TTC here as well, which we've actually taken 35 school children from the age of 12 to the age of 18 through a 3-month program and specifically going into some more of these ailments and what to do from a research perspective, but also how they've managed to apply that for themselves, starting to focus on the focusing, the concentration, being free of distractions, being centered in themselves, being emotionally aware, being present in the moment. So all of these fantastic benefits which are available there through yoga and meditation. And Bill, I think it's fantastic to hear some of the work that you're actually doing out there on Global Transformation Project and Qigong as well. I think it's absolutely fantastic. And it's really much needed for this research to get out into the public domain. I'm actually working on yoga therapy myself. I'm going to be graduating this year as well. And a lot of my research work involves looking at different elements, looking at different ailments, and how to be able to free ourselves there. To be able to release that fascia, to be able to look at what different movements, what different meditations, going through the whole of the Panchakosha system, which begins with the physical, going into the emotional, the mental, the spiritual, and then being centered in ourselves. And I think it's a similar kind of philosophy there that you've got with yoga, with Tai Chi, with Qigong. And so it'll be fantastic to see there, if you're up for it, how we can collaborate and how I can actually help to serve your community there as well. And
Thank
Sharon,
you.
as always, it's fantastic that you're actually bringing on some amazing work and to see your film now that's coming into fruition as well. I know just how hard you've actually worked and how much work and perseverance has taken to get there. But I just want to say a massive congratulations to you on the work that you are doing and just on the impact that is creating as a ripple in society globally. Keep up the good work.
Thank you.
Thank
Thank
you.
you, Riddhi. Thank you, everyone. Bill, would you like to say something before we wind up now?
Yeah, a couple of things. Really, on the work that you're doing, people like you are pioneering what will happen in public schools all over the planet in coming years. And so any videos that you have of, student interviews or, or what you're doing in schools, we're posting those kind of things at globaltransformationproject.org. And I was Ankur was asking about the public education aspect. And so at globaltransformationproject.org, we have a tab of mind body in schools. So it's people that are doing things like what you're doing, Riddhi, that are already happening in public schools all over the planet. And it's just profoundly exciting. It reduces bullying, test scores go up, GRE reading scores go up, math proficiency skills go up, verbal fluency goes up. Regular meditators, their IQ goes up 20 points. And so these are massive things that could prevent or treat up to 90% of the health issues that people are facing. So we're talking about trillions of dollars in saved health and also social costs. We could ultimately, what the science is showing is that if we spread this to mind-body practices, Tai Chi, Qigong, yoga, meditation, mindfulness, as a core part of 1 hour a day public education worldwide, we would in time virtually empty our prisons because the social implications are massive. So we're talking about endless trillions of dollars in savings at a time when the world is going to desperately need all these resources. And one thing that you mentioned, Amrita, was the benefit of the slowness of motion. And that's a really big insight that you had there, because what the science shows is that anytime mindfulness practices like Tai Chi or yoga or Qigong are compared to like more aerobic type exercises, the mind-body practices always outperform. They always show much greater health benefits. And so that slowness of motion is and you kind of alluded to it a bit, Amrita, but it was what it does is it fosters the mindfulness. Like Lee Holden was really good at telling us to feel the energy when we were going through the slow motions. And so that connection of the mind and the body that only mind-body practices offer. Other exercises don't offer it. That has profound implications for school children, all school children, as they learn these things. Really, I think a lot of things, what the science is pointing to is that a lot of things that we accept, like hypertension, diabetes, arthritis, when we get this into public education all over the planet for 12 years with each student, a lot of those things, they're going to be in history books. They're not even going to be things that people are even dealing with. Yeah, it's a really exciting time.
Yes, it's
for
very
the planet.
exciting. Thank you very much, Bill. Thank you, Riddhi. Thank you, everyone, for making this episode again a wonderful one. And we would like to see each other again for the next episode, which is on yoga and meditation, followed by the other week with Indian knowledge system and homotherapy. And so my special thanks to all the contributors, as well as the Tom Pfeiffer from Prague, who has come, as well as Dr. Lal Goyal, Rotarian Lal Goyal, and Sharon, as well as Riddhi, to contribute and make this episode again a good one. Let's wind up with the Gayatri Mantra. Om Om Bhurbhuvasvaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayat. Om Bhurbhuvasvaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayat. Om Bhurbhuvasvaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayat. Om Shanti Shanti Shanti. My last and final thanks to our technical director Nishit Kotak, as well as our founder and director Neil Kumar, for making this episode what it is. Thank you so much. Thank you so much, everyone. Thanks a lot. Good day and good night. Bye-bye.
Sharon,
Bye-bye.
can I just quickly,
You can ask her, because I'm ending the meeting. It's midnight here. Okay, thank you.
Well, you can
Bye-bye.
go.
Okay, bye-bye.
Bye-bye. Bye-bye. Thank you.
Thank you.
Good night.
Good night.